We're good for launch.
Okay. All right. Well, then welcome back. Um, we're going to start the public session, and I think Derek, it's over to you.
Thank you very much, Karen. Yeah, everything's good on my side. So, just want to remind everybody to be mindful of side conversations as we are live streaming this session. Okay, so good morning and good morning to everybody who's joining us on YouTube. In the interest of time, I will go ahead and introduce the board of directors. So we have myself, Derek Summers, Kevin Cloutier, the vice chair. We have Omar Farouk, government appointee, Paul Imola, elected member, Peggy Judge, government appointee, Stephen Kinsella, government appointee, Alicia Munin, government appointee, Tanya Namabin, elected member, Carlos Pacheco, elected member, Grzina Subsinska, elected member, Carlo Sicoli, government appointee. From the administration team, we do have Fazal Khan, our registrar and CEO, Amy Stein, deputy registrar, and behind the scenes, Carolyn Robertson, and a few others of your team, which I won't necessarily specifically highlight. And yeah, so good morning to everybody. Welcome. And so I would also like to jump right into our land acknowledgement. So while this meeting is taking place virtually, I would like to acknowledge that the land where I reside, the traditional land of the Algonquin Anishinaabe peoples, who have lived on this land since time immemorial. We are grateful to have the opportunity to work, live, and learn on this land, and by doing so, pay respect to its first inhabitants. Welcome, everyone, and note that registrants joining us on YouTube. Wow, I sound so old. Registrants joining us on YouTube can use this as self-directed CE hours. Okay, so now we're going to hand things back to our facilitator, Karen.
Hi, welcome everyone. Just a few rules of engagement for our meetings. I think for most of you, this will not be new, but just a reminder. Stay on stay on mute unless you are speaking. And when you wish to speak, please use the raise hand tool, either in the Zoom tools, or assuming you're on camera, you can raise your hand live. But the tool in Zoom will allow me to know who put their hand up in which order. So that can be really helpful when we've got a lot of people looking to speak. Of course, we're always looking to get as close to a full consensus as we can on our decisions as a group. So we will be using consensus building process when we have to collaborate on more complex decision making. I will make sure that we hear from everybody and that we can make sure that we're getting to that level. When we have a decision on the table, we'll use the high five, and I think most of us know what that is. But 1 through 5 of where your level of agreement is with the decision will help us determine if we need to have any further discussion before we go to a motion. If there are no questions about any of those rules, I'm not seeing anyone jumping to speak, then I think we can move on to the conflict of interest declaration. Derek, it's yours.
All righty. Okay. So, I mean, and this part of the this part of the day is always a little bit formulaic, but I gotta love the consistency of it. So, does anybody have any conflicts of interest to declare? Speak now or forever hold your peace. Okay. Seeing none. All right. So that looks good, Karen.
Yep. So now you can move on to the adoption of the agenda.
Thank you. Are there any amendments to today's agenda? Seeing nobody raising hands or commenting, so that's great. Could I have one of you make the motion to approve the agenda for the day? Grzina, I saw you first. Kevin, you're my seconder. All in favor? Fantastic, and that will pass. Okay.
All right, so now you can move on to the adoption of the minutes from the December meeting.
All right. And I'd just like to remind everybody, if you weren't here for those meetings, just abstain. We'll give you that option kind of towards the end there. Does anybody have any amendments that they'd like to make to those December minutes? Seeing none, can I have someone make the motion to accept the December minutes? I will go with Stephen as my motioner, Alicia as my seconder. Thank you very much, you two. All in favor? Fantastic, and those pass.
All right, wonderful. We're now going to move on to the financial reports, and Blessing Adebimpe, staff accountant, will be presenting. Blessing, please join us on camera. It's over to you.
Hi, good morning, everyone. I'll be presenting the financial variance report today. I'll be sharing my screen. I'll be presenting the financial variance report for the period ending December 31st, 2024. The purpose of this report is for review and approval by the Board of Directors. This report compares year-to-date revenue and expense with the total annual budget and includes a comparison with previous year's financials. For considerations, this report covers unaudited financial data for revenue, board committee expenses, and operational and administrative expenses up until December 31, 2024. The report compares year-to-date revenue and expenses against annual budget and previous year's figures. The purpose is to assess whether financial trends align with expectations at year-end, with variances typically closing up as the year progresses. These figures are largely unaudited, and final audit results will be available after March 2025. For consideration, scroll down a bit. Yes. The total revenue for the year is $3,704,634, exceeding the 2024 budget by $74,738, which represents a 2% growth. This growth is largely driven by investment income, which we saw a large rise in this year. And also, the growth is driven by the increase in number of opticians for the 2023-2024 period, largely as a result of delayed June 2023 exams. This is a one-off occurrence and is not expected to happen again in this financial year. Also, for further consideration, board and committee expenses meetings accounted for $176,968, which is $34,179, which represents 24% over budget. There are a key number of drivers that accounted for the over budget expense, including quality assurance committee expense, which rose due to higher accreditation requests. However, this cost was mostly offset by accreditation fees. Registration committee was largely underspent due to shorter than expected meeting durations. For reference, I'm going to be on the variance report page. The governance committee meeting exceeded its budget by 37% due to additional screening committee meetings. The board's decision to also increase in-person meetings from 1 to 2-person meeting led to a significant increase in budgeted expense. Further down, we'll be looking at the operation and admin expenses. Total operational expenses are $3,269,481 on budgets.
Blessing, I think
The
we're having a
key
bit
point to
Blessing, sorry, hold on one second, Blessing. We're having a bit of trouble with your audio. I wonder if turning your camera off might increase the bandwidth for your audio. Do you want to try that?
Sure, definitely.
Thank you. Let's see if that helps.
Can you hear me better now?
We can just try and speak directly into your microphone.
Oh, okay. I will just be taking the board and committee expense again, just in case anyone missed anything.
Thank you.
So as I said, total expense for board committee meetings are $176,968, which represents a $34,179 over budget expenditure. The key variances for this includes quality assurance committee, which had a higher number of accreditation requests, but this cost was largely offset by accreditation fees. Registration committee expense was also underspent due to shorter than expected meetings. Governance committee exceeds its budget by 37% due to additional screening committee meetings. And the decision to move from one in-person meeting to 2 in-person meetings in the 2024 financial year also accounted for the overspending in the board and committee expenses. I'll be moving to the operation and admin expense now. The total operation expenses are $3,269,481, underspent by $12,161, 1% to the budget. The key points to note for this include the quality assurance program, which saw a significant underspending of 75% due to improved compliance. However, selection process has been reviewed to improve budgeting going forward. Also, the investigation cost exceeded the budget by 78%, $50,799 due to unanticipated investigation needs and overall difficulty in anticipating investigation scope. The board is recommended to approve the financial year variance report for the period ending December 31, 2024. Thank you.
All right. Is there any feedback or any questions for Blessing about the variance report? Thank you, Stephen.
Thank you. I don't know if Blessing, if you're able to answer this, or maybe it's a Fazelle question too. In regards to the cutbacks of students coming into the country, for example, on Friday, Georgian College in Barrie just laid off 224 staff members, and they've released information that they're going to be another $40 million short going into next year's budget because of the lack of international students coming through. With our anticipated revenue that we budgeted this year, do you anticipate it being drastically affected at all? And this, I'm just going by what Georgian's reporting. I don't know how the other colleges are pairing out. And as we move forward into the next couple of years, do you have any economic forecasts? That's how it's really going to affect our revenue?
I can speak to that, Karen. So, Steve, very good question for sure. It's definitely on the radar. From our discussions with the schools and how it usually works, from intake to sort of output is about a 2 to 3 year cycle. So right now we're probably going to see for the next year or so steady output, but we'll be monitoring for next year's intake in September, etc. And that'll impact probably planning for like a year or two down the road. So there's always this lag between intake and output. So I think we're okay for this year and probably next year, but we should probably be looking at numbers a little bit more closely. Georgian is more impacted by international student composition than Seneca, but both schools are significant contributors to our applicants for registration. So Georgian more than Seneca. I know both are pivoting to try to do more domestic recruitment, but this will definitely be on our radar in the coming years for budgeting.
Thank you very much.
Any other questions or comments? I'm not seeing any other hands. So unless, Blessing, you have any final words or anything. Oh, Carlos, yes.
Just a quick question. Have we, with the way the economy is and the way everything's going on right now in Canada, especially Ontario, have we looked at licensing fees for our opticians? Have we looked at any ways to help them out?
Fazal, do you want to take that one?
Sure. So, Carlos, we set our licensing table, our fees table, every 5 years, so we're sort of have some predictability on revenue. That said, if there's a major wrench in the works, like what the pandemic proposed, we do look at it in the moment if it's an urgency. But typically, we're looking at these things every 5 years. So we just came off of that about a year or so. We set the table.
Thank you. Paul. You're muted, Paul.
Sorry about that. The items on the chart that are marked in yellow, the unplanned variances, those numbers, I don't even know how to really word this, but does the amount of that, like the 49%, the 37%, the 121, is that in staff's mind and everybody's mind, are those acceptable? I know we're going to keep an eye on them, but are those the norm type of variances that we can expect?
So,
Um,
oh, sorry. Yeah, Blessing, go right ahead.
Typically, they're not the norm. However, that's why we've pointed them out in the report, explaining why this happened, and a lot of them occurred for one-off occurrences. For example, like the quality assurance was mostly as a result of the increase in accreditation requests.
Yep.
And we explained that the cost was also offset. The governance was also as a result of the screening committee, and going forward, we've planned for it better. And then the investigation is mostly difficult to plan for, basically because of you cannot define the scope of investigation prior to knowing the investigation is going to occur.
Right.
So I hope that answers your question.
Yeah.
Thank you, Derek.
I just wanted to add on, Carlos, I should say, not Carlo. Carlos, just keep in mind, I mean, yes, we visit, as Fazal said, to add on to that, we do visit it every 5 years. However, if things happen, we pride ourselves on being responsive. So, I mean, if there is a need, if there is a concern, depending on how things turn out with what the general climate is right now, it might be something that we would be readdressing if necessary. So. Sorry, Fazal, I hope it's okay for that.
Yeah, no, absolutely.
Okay, thank you all. Any other questions or feedback for Blessing and the team? I'm not seeing any hands. So Derek, I think you can go for your motion.
All right, so thank you, team. Blessing, great job as always, thorough and very comprehensive. I always love because you answer the questions before we actually get to make the questions, which is quite lovely when we're doing this process. I need someone to motion to approve the financial variance report as presented. Regina, you'll be my whatever. And can I have a seconder? Tanya, you're my seconder. All in favor? And that looks like it passes. All right, thank you.
All right, wonderful. We are going to be hearing beginning at 11:30 from Leslie White-Eye on the Indigenous Community Engagement Project. So I think we're going to be going to break a little bit early, and we will.
If I could, Karen, to interrupt you.
Yeah.
I wanted to just quickly check. I mean, we just started. Do you guys need a break at this point? I'm seeing head shaking. Anybody need the bio break right now? All right. So I don't mean to jump in on you, Karen. Fazal, is there any way to bring our speaker in early?
So in the background, we have been able to get Leslie to move up to 11:15 from 11:30.
Okay.
In the meantime, we've got 15 minutes till then.
Okay.
So I'm on after lunch with some monitoring reports. I'm happy to maybe go through one or two before Leslie's on deck.
All right, team, do we want to hit a couple of monitoring reports, knock some stuff out? Okay, perfect. Sorry, Karen, so we're gonna go ahead with
that's
Fazal
okay.
on the monitoring reports.
That's okay. I will jump right there. So in that case, we're going to move to agenda item 5.0, which was scheduled for 1 p.m. And that will be the financial planning and budgeting policy monitoring report to begin. And I'll just share a little bit of context for everyone. The purpose of the monitoring reports is to have a system in place to periodically check in on each of the board's governance policies to make sure that they're achieving the desired results. So, this is one of the primary ways that the board exercises its risk management responsibility. So these policies in the governance manual have established risk boundaries that the registrar is to operate within. And the registrar is required to satisfy the board through these monitoring reports that the policy is being reasonably interpreted and reasonably achieved. Therefore, when the registrar brings forward a monitoring report, the board will be asked two main questions. One, was the registrar's interpretation of the policy reasonable? And two, did the registrar comply with the policy as reasonably interpreted? The feedback that the board provides during this process will inform the evaluation of the registrar's performance and, as a consequence, the organization's performance. So, Fazal, I'll turn it over to you to present your first report.
Okay, great. Is everybody able to hear me okay? Perfect. Okay, so the financial planning and budgeting monitoring report. This was last updated by the board in 2020. This report covers between January 2024 to December 2024, so pretty much all of last year. And then the next one will be due February, March of 2026. So the first thing is, and I'm not sure if we can get a screen share on it, but nonetheless, everyone's got it in their package. So I'm just going to go ahead and read, and then we'll see if the staff can pull it up on screen for us. So the first requirement in the policy is that we have a multi-year strategic plan. So the evidence and interpretation portion of that report basically speaks to a few things. We operate with a multi-year strategic plan. The board receives this semi-annual monitoring report on the strategic outcomes policy. We develop and we have reviewed and developed the 2025 fiscal budget, ensuring that funds were allocated to specific expense accounts, including about 87,000 budgeted for strategic initiatives. And this is to ensure that the board, the committees, and the staff are provided with sufficient financial resources to achieve those strategic outcomes. As far as reasonable fund assignment, funds are allocated after an analysis of historical costs and data trends, as well as budget variances from previous years and forecasted costs. The forecasted costs are calculated based on the planned activity for the year ahead, vendor quotes, and trend data. I will report that all operational and strategic activities last year were fully funded. As far as the requirement for funds assigned for board use, a total of $142,771 were allocated for board and committee expenses, as well as $85,000 allocated to board and strategic initiatives. Other costs such as training, development, legal fees, fiscal audit fees, stakeholder engagement activities have all been built into the college's operations and administrative budget item line. As far as the requirement for regular analysis, I conduct a regular analysis of strengths, weaknesses, opportunities, and threats, basically a SWOT analysis, which may impact the college's budget. Similar to what Stephen had raised earlier, things like fluctuations in immigration trends and things are definitely being monitored all the time. We consult with external consultants such as Graywell Guyot, our external audit team, to obtain their professional advice. Myself, the deputy registrar, review the quarterly financial variance reports to analyze whether our operational activities are trending on target. As far as financial projections, the 2024 budget was developed using credible projections of revenues and expenses based on historical data, our planned activities, and the data trends. Lead staff, such as our directors, our vendors, are all engaged in determining the coming year's financial requirements. As far as the budgeting process, budget notes disclose any planning assumptions or expense activities predictions with input from the college's management team. Forecasting models now are based on a 5-year historical to ensure that revenue and expense trends are captured pre and post pandemic, just so that we're a little bit more accurate. Typically, it's been on a 3-year cycle. As far as reserve fund expenditure, as of December 31st of 2024, none of the contingency reserves were accessed. As far as sound financial planning, in accordance with our investment policy, the college works with a credible financial planner from a AA rated financial institution to develop our long and short-term investment plans. And as far as budget development, as I've said before, this year's budget, the 2025 budget, was created with input from the board regarding key budget planning assumptions. The big one driving it is the 2023 to 2025 strategic plan. Especially there's things identified in that plan, such as the unauthorized practice program. So staff were consulted regarding both ongoing work and special projects. Consideration was also given to new realities, such as the introduction of the inactive class with a lower registration fee, as this will factor in with movement of registrants between active and inactive classes, which will affect the college's main source of revenue. As far as public interest considerations, the policy promotes financial protection through clear guidelines and regular reviews of financial planning and budgeting processes. No DEI concerns have been identified with respect to the college's investment strategy. And as far as risk management and consideration, the financial planning and budgeting policy are aimed at minimizing the risk to the college's finances by focusing on proper budgeting through trends and hedging risks through reserves. So with that, I'll turn it back to you, Karen.
All right, great. Thank you. Let's start with any feedback or concerns with regards to the interpretation of the reserves policy. Stephen.
Yeah, thank you. I just want to commend Fazelle on an excellent job as usual in not just doing the status quo, where a lot of other companies are just and organizations are just able to accept, and then we'll try to plan things as they come down the road. Again, the staff at the college continually to look to the forefront and can bring out new things and are always looking ahead, and that's what keeps this college moving forward. Thank you.
Thanks, Steve.
Thank you. Any other comments or questions? Derek?
No.
No, you came off mute, so I thought I would check in. Okay.
Because you're going to ask me to talk in a minute.
Yeah, well, I know. Okay, so I'm sensing that we can probably move right to the motions for this. So Derek, you can take it away.
Thank you, Karen. So remember, guys, this will be 2 motions for this one. So motion number 1, I need someone to make the motion that the board approve that the registrar's interpretation of the policy was reasonable. Regina, I'll see you as my firster. Omar, you'll be my seconder. All in favor? Fantastic, good. And then I need someone to make the motion that the board agrees that the registrar CEO complied with the policy. Can I have somebody? Paul, you'll do my first, and Stephen, you're my seconder. All in favor? Perfect, thank you very much.
Okay, great. Fazal, do you want to move to the strategic outcomes policy report, or it looks like you were thinking that one might take a little bit longer in that case on a schedule?
You know, with the strategic outcomes policy will take a little bit of time.
Okay.
I was thinking maybe I could knock off the corporate identity, public image, and communication policy. That's okay.
Yeah, that's wonderful. All right, so everybody, that's item 5.4.
Okay.
So we'll move to that one now.
Okay, so this monitoring report covers the period from January 2024 to December 2024. So again, all of last year. The next time you'll see this report, it comes up every 3 years. So you'll see it in March of 2028. So pretty straightforward. It's a short policy. You know, the first policy requirement is the name of the organization, corporate identity, and seal. To that, no changes have been made to the name of the organization or any of the corporate identity or seal during this reporting period. As far as external use of corporate identity, the college regularly is scanning the environment for unauthorized use of our image or logo, acting when necessary, and sharing content and documents in a PDF format with third parties, just so that there is no alterations of our original content. The college regularly participates in programs and events that support our ability to carry out our public protection mandate. All external programs and initiatives the college participates in are consistent with the college's strategic outcomes and values. And our presentations include presenting to optometry students on professional responsibilities and ethics, participating in continuing education events aimed at our registrants, and engaging with focus groups as we prepare for the 2026-2028 strategic planning cycle. So all communications and written materials, advertising items such as banners, etc., are branded as per the college's corporate logo. And our communications manager, Carolyn Robertson, continually monitors external sources such as our social media platforms for improper use of our college's corporate identity. As far as the corporate seal goes, as per the bylaws, signing officers of the registrar, the deputy registrar, our chair and vice chair. Only these individuals have the authority to sign or use the corporate seal on behalf of the college. And all of that is managed through the college's executive office to ensure compliance. The next requirement, as far as internal and external corporate communications and public relations, it overlaps a little bit with before. As I said, Carolyn, our communications manager, oversees external communications and public relations. She works with our social media consultants to manage the college's presence on platforms such as Facebook, Twitter, or X, LinkedIn, and Instagram. She also works with senior staff to review all communications communications and images prior to publication. So Amy and I are involved in overseeing all of these as well. All public communications are geared towards furthering our college's public protection mandate. And communications have included this past year informing registrants about important changes to our standards and guidelines, directives and regulations. So last year, much of that communication was around changes to the new registration reg and the professional misconduct regulation. We participated in the Ontario Opticians Association Roadshow for 2024, which took us not only to Toronto, but Ottawa, Sudbury, and London. And typically our communications are reminding registrants about their ongoing professional requirements. Other things that we communicate out are things like inviting registrants and other stakeholders to participate in board meeting or participate in stakeholder feedback surveys. So with that, that is my report on this monitoring report. And Karen, I'll turn it over to you for any questions and comments.
Wonderful. So the floor is open to comments or questions or concerns. All right, I'm not seeing any hands. So I think, Derek, we can go for your motions.
All righty. Thank you, Fazelle, for the report. Again, two motions. I'm asking someone to make the motion that the board approve the registrar's interpretation of the policy was reasonable. Kevin, you're my first. Gershina, you can be my seconder. All in favor? And that passes. Second motion before you. Could I have someone make the motion that the board agrees that the registrar CEO complied with the policy, please? Alicia, you're my first. Tanya, you're my seconder. All in favor? Fantastic, that passes as well. So thank you guys for letting us kind of move some stuff up. Appreciate putting you on the spot like that, Fazelle. It's appreciated.
No
And I will hand it back to Karen.
Okay, so are we ready to bring Leslie into the meeting?
Okay, let's do that. I think she's in the waiting room. And then what I'll do is an introduction and set some context as to what we're hearing.
Okay, great.
Welcome, Leslie.
Hi everyone.
Thank you for accommodating us.
Yeah. Thanks for having me.
So Leslie, I'm going to, oh, this is great. Sean has just joined us as well. So we'll let him in. And Leslie, I'm just going to introduce you to the board and set a bit of context, and then we can get started with your presentation.
Sounds good.
Okay. Welcome, Sean.
Hello.
Okay, so Sean, I'm just going to introduce Leslie and set some context to the presentation, and we'll get started. So, folks, what we have here, Leslie White-Eye, who is Anishinaabe Ojibwe from the Chippewas of the Thames First Nation. She is a former chief of her community and has experience working with private, municipal, provincial, and federal governments and agencies on the First Nations regulatory, economic development, environment, and intragovernmental relationship building. Leslie has a passion for First Nations traditional governance structures with leadership experience as a Treaty Council delegate, and while chief as one of the 5 First Nations parties, several treaties in the Southwestern Ontario region. One of Leslie's many skills are that she coordinates cooperative spaces for participating with First Nations to discuss education, governance, schooling systems, and intergovernmental relations with Canada, Ontario, and other allies. So with that, it's here where Leslie and our colleagues at Council Public Affairs assisted us with one of the cornerstones of our 2023 and 2025 strategic plan, specifically Strategy 1.3, which states ensuring that patient care is more culturally safe and inclusive. So in 2023, we began the planning stages of engaging the Indigenous community to better understand the challenges they faced and specific needs the community has as it accesses eye health care. So initially, this was a CO-specific project. However, our colleagues at the College of Optometrists were invited to join us in this engagement as we deduced that it would likely be relevant that their profession would also benefit from this engagement and ultimately benefit the community at large if both professions were aligned in their approach. So to that end, the goal of this engagement was to inform the development of a standard of practice around cultural safety and humility for each of the professions. Leslie was actually very instrumental in guiding the colleges on how to engage with the community in a culturally respectful and meaningful way. She also curated the group, our participants, and she facilitated the engagement sessions. So with that, I'd like to turn it over to Leslie to give you an overview of our project and update us on the work thus far. So Leslie, I'll turn it over to you.
Hi, thanks everyone. Just some introductions. Again, thank you for that kind introduction. I'm just a community person, love working in community. I have 3 children. I'm a classroom teacher, which got me into the education sector, which got me into leadership, which eventually got me into governance work on a number of topics. But I'm happy to be here, and all of that experience that I'm bringing is hopefully going to, you'll see some of that in the project that you've undertaken, but also in the report, but also in the recommendations and the things that have come out of our discussions with the circle participants. I'm a member of Chippewas of the Thames First Nation. I'm just outside of London, Ontario. We're about 20 minutes from there. We're an Anishinaabe Ojibwe community, and there's roughly around 3,200 members, half of which live in the community and the other half mostly in the London region, but obviously all over the world. I'm going to really focus on a couple of things. The first thing being this, the question was around engagement, and that's where my experience is. I'm not a practitioner of any understanding of our expertise in eyeglass wear or its delivery to patients, but I've learned a great deal through this circle of individuals like myself who do wear glassware and have faced and we're so willing to share their stories. So that's the intent here, is to convey hopefully their voices on their behalf, and hopefully you see that in the report that was prepared after engaging in the 2 circles. So we really, I think what was important, the report was broken into 3 parts, and I spent a particular amount of time in the first part just providing the college with some context. I think it's really important that we place this question within a historical context. And in my work in education, in my work in political affairs, in my work in community development, and now here with you in the health sector, absolutely, there always has to be attention paid to the distinct nature of the relationship between Indigenous peoples in Canada. And I think that anyone who earnestly wants to engage and learn and develop relationships should come with that level of beginning awareness and understanding, and hopefully acceptance for that fact as as a citizen of Canada. So you'll find the report tries to, at a very high level, give you some background information on the particular historical, but also treaty-based and specific differences between the three identified Indigenous peoples. These three categories are particularly important to understand in the context of the Canadian Constitution and Section 35. And I think that if there's anything I would, and I hope the report comes across this way, is that that particular understanding is going to be key in terms of helping people find reason or rationale for treating their clients, their patients, their Indigenous customers in a specific way because of that historical space they find themselves in, and the particular ways in which health is delivered to them, and the historical ways in which others have thought about them. It puts them in a specific space in dealing with the health sector. So the report does provide that background, and we have provided a bit of research and literature review on some of the key factors that have been said in the past in research, but there's limited research, but also then reaffirmed by the individuals sharing their sharing their stories during the circles. Big key one is geographic. You all know Ontario is a huge province, and there's some real disparities when it comes to accessibility for many First Nation communities and Métis communities in Ontario. Those that live, we've heard from two of the participants in the circles that the time taken and the cost to get access to opticians and good care is difficult, and they just reiterated what the research has shown. The other part about this is the social experience. So particularly some of the stories reaffirmed again, there's certainly language barriers. Those are some obvious ones. But there's also this systemic belief about First Nations and Métis and Inuit customers, clients, patients, and what they're able to bring to I don't want to call it a transaction. It's more than that. I think they're asking for more than that, but it is really some important experiences that were highlighted based on their personal experiences working with some opticians, not all, in terms of how they were viewed from the moment they walked into your place of care. Many of them felt that because of their particular health circumstances and the ways in which providers are paid or resourced, there's often a disconnect in terms of knowledge and awareness of how that works on both sides, but also sometimes, not all, I guess, an unwillingness to learn or even go so far to figure it out and offer that as an option to work through non-insured health benefits. But we'll talk about that shortly. I think what was important for me and the team here is that we needed to identify the journey from the perspective of an Indigenous patient, drawing on what was shared with us at the engagements, and also from what we've come to learn through the literature review, we wanted to make sure that all the components of a Indigenous patient's potential journey were included in this map. I think it would be really important that your members, your registrant members, be walked through what those particular points, I guess, of we'll call them decisions that have to be made prior to even accessing your care, the moment they walk into your care, the time spent in your place of business and what happens there and the environment. And then all of that is kind of the obvious pieces, but what's not so obvious is this other part of the trajectory of the journey, and that's the legislative barriers, but also the particular coverage eligibility barriers that can impede a patient from even entering your workplace, let alone accessing the care because of their own lack of understanding of what's available and what can be provided, to the interpretation of opticians and how they see that eligibility and coverage and how they convey what they know to their client, to their patient when they enter the office. So all of that is going on in the background, and that was repeated by many during the engagement circles, this kind of sense of how do I convey who my provider is? Will they understand? And will they support that engagement with that non-insured health benefits, particularly for First Nation clients and the Inuit clients? I'm just going to reiterate again, though, it's really important, I think, if you ever were, as a board, rallied behind a module or a learning opportunity for your registrants, the importance of distinctions-based approach. I'm using the term Indigenous here, but you'll see me go back and forth between using First Nation, Métis, or Inuit, depending on the particular context I'm talking about. There is a distinction on how they access particular benefits and how some can't and some can, and the approach in which the information that has to be exchanged is different between the Inuit, for example, and the First Nation client. And that's the historical context that's really important. And that was said clearly, particularly around the Inuit participant. I think many just kind of put this big umbrella that NIHB is going to cover this way or that way. And we found that it was important to understand the Inuit experience in terms of their identity and their status and how they gain access to non-insured health benefits is different than a First Nations use of for example, the Indian status card. The Inuit have a different methodology for identifying their benefits under the NIHB. So all of this to say that it was clear that a distinctions-based approach had to be followed in any kind of awareness or engagement session you might consider working with your fellow members, because this simplification of the Pan-Aboriginal approach is not going to work. And that's often what gets us into trouble in our exchanges with opticians, is that lack of awareness and understanding. So the methodology we used, and I really wanted, and I just want to give a shout out to the leadership here at the College of Opticians. The team here were very open to the recommendations that we were making about how to start this work. I really have a strong belief that this work takes lots of time. It takes lots of tries, and not every try is going to work, but each try, particularly when it's attempted by those that do the most work and can cause the most change within an entity or institution or organization, that changes you. It changes leadership. It changes, you can't turn that back. And I guess what I'm saying is, my experience working in the education system, this holds true there as well. If you continue reach out to third parties to do the work when it comes to truth and reconciliation, you're not gaining any experience yourself in the hard work it is. And oftentimes you're putting yourself in a position of not gaining trust in the way that is most beneficial for each party to benefit. And by doing the work yourself, meeting with the clients as your leadership team did here with us, they attended both circles. They were present to answer questions. They didn't overemphasize their understanding of what they felt they should do. They really just created an open environment to hear everything, trusting that their words were not going to be dismissed, or their words weren't going to be dismissed or in any way taken for granted. So just shout out to the team there. So there were 2 discussion circles. I reached out to individual I knew that either worked in the health sector, were also eyeglass wearers, and also who might also be working at a program level and just responsible for community health services. And so we got a wide range of not only positions, but also of experiences. Some had families and children, others were elders, another they're younger and living in urban settings, coming from First Nation settings. So there was a wide range of experiences within the circles. Go to the next one. So I honestly think that if you're going to do any engagement work, and I'm glad the team agreed with us, is that you really do need to start with stories, just to get a handle on how grassroots on the ground First Nation, Métis, and Inuit people think or even talk or know about the question you're asking. And by doing a small engagement, I feel strongly that you can be truthful in testing the water. You can start to build your best guess about what a larger engagement is likely going to focus on, which means you're more ready to be able to respond or act on when you move to a larger engagement or a more systemic engagement. By moving into a systemic engagement that's huge and large, you just never know what's going to come at you, and sometimes those spaces, if not managed properly, can really turn sour quickly. And so by getting your feet wet this way, listening to a small group of really I guess well understanding of the broad scope of what the question was, you can kind of be prepared now and start to build your own readiness for a larger engagement. So I'll just say this, so I'm back on methodology because I think it's just so important, but you can see here some of the stories. By the way, the First Nations elder, she still continues to deal with her eyelid. We talk about it now. I see her in community spaces. She has a tape. She's actually taped her eyelid up so it doesn't get in the way of her vision. But she just, whatever the result of her diagnosis and the support she was given, they just never come to a conclusion that would allow her eyelid to be addressed. And so just a story aside there. I think also, young parents trying to navigate a system. It was important that the busyness of life and the fact that you're dealing with NIHB, we all understand the work opticians have to do in order to engage with them, and also the work that the client has to make. And you could hear that by the participants in the circle, that added factor really puts a lot of stress on families, and it must be putting stress on opticians too, because there are opticians who are refusing to do and take clients that are NIHB. And so there's something about that, and you'll hear that later in the recommendations around advocacy and change. I'm not pointing in any one direction for blame, but there is something there that is inhibiting people from entering your doorways for fear of, having to engage NIHB through you, and however that feels and is operationalized. But also to say that there were many stories shared, and you could glean from all of the stories these kind of key areas or areas of action. So we came up with 7 key themes. We felt that first and foremost, the most important was a strategic direction. We understand the question being asked by leadership here is, how is it that our standard of practice to deliver on a culturally sensitive and appropriate care for for the Indigenous population, how is it we will do that work? And that's a really important question. And I think of all the themes, I think this is the most important one for the positions you all play as board members, because you really champion those processes and make those processes happen, but also hold people accountable to them. So I understand your role as board members and how important that role is to do these kinds of things. So that's why you're seeing here first, and I'll be drawing on it later in the presentation. But these are the other 6 themes that came out of it. There's clearly I think an impact or an outcome that will be positive if you focus in on registrant education. There's going to be I think benefit and positive outcome for you if you delve into this idea of choice and flexibility in care and service delivery. But there's also other things I think too that registrants themselves could be encouraged to do through the work that you do here at the college. You could encourage relationship building with local communities, but also in immersing yourself in communities in ways that you may have never done before to get a greater understanding. I'm talking to you as an optician now. And then also just, gather more information, or encourage more research and data on this question around eye care in Indigenous populations. We found, and it was evident in all of the stories, that every person that was part of that circle could reach out within, in their extended family, of the impacts of diabetes and chronic disease on their vision. And so there's something about that too that needs to be thought about. And then finally, is there something there within this report we'll invite you to consider? Is there something about the college and your fellow colleges that could work together, band together on collaborating on some of these broader, bigger issues when it comes to Indigenous populations and their eye care and eye health? And then finally, the administrative barriers. We recognize that the NIHB is a federal health program. What is it that a college could do really to engage or even lend insight into those issues? Well, I don't know, but I think you could, because you have amongst you the voice of all the opticians in Ontario. And I think with the force of that, combining with other provinces, for example, or with other colleges, there's something behind that amount of voice that you could leverage to bring attention to these matters as allies. So with that, we felt, we broke the themes into kind of 3 areas. If you were thinking about a strategic plan of where you could start or, decide if there's something there that fits with your current trajectory of activities. Next one. We further break down the themes under short-term, mid-term, long-term. I always find this really beneficial in my strategic planning that I do. We feel like in the short term, some quick wins are really important. This also emboldens your message when you do farther larger engagements, that you're not entering into an engagement session with no record, no record of engagement or no story to tell on what you've done. I think short-term initiatives that have quick wins, like a strategic direction that you've been thoughtful, you're thinking about the work. You don't have all the answers, but you're doing some preliminary work. These are all important things that really, I think, put you on a good footing for the medium term work, which is all of the things we talked about in the previous slide, but also can be done very strategically, but given an amount of time to do them properly. And finally, long term, if there's any way the colleges could become allies in the work of advocacy for how healthcare is thought about federally when engaging, like a client like myself, when I engage any kind of health service and I have to identify myself as a status member, all of what that means happens. So there's something there. Opticians are making choices. Our participants told us this about what they think they can deliver through an NIHB program. And clients not necessarily don't always agree that what the optician is telling them is true. And in many positive cases, though, we were told the optician was very helpful and very supportive of coming away with a good feeling that I just love my glasses. So there's a lot of good stories there too, as well, from the circle that really had great relationships with their opticians. And I think I could say that of all the health sector, you guys are probably facing the least amount of negative assessment or evaluation for your services. For the most part, people feel positive about the spaces that opticians create for them. They just wish for more understanding, particularly those opticians that are in specific spaces who service large First Nation populations. If there was any kind of strategic focus, it might be on them, those most closest to the communities. So the next one. I guess I want to end off by just reiterating again, the strategic direction. You're all board members, your most senior leadership is here in the room. And if there's anything I've witnessed over the many years I've been doing this work, is change doesn't happen without champions who champion that at every level of their organization. And board members can really signal for everyone the importance of things. And the fact that you asked these questions has probably already signaled for those in the know that something's on the horizon in terms of standards of practice and change. And even just the question, raising the question, maybe not having all the answers, that signals a lot for everyone doing the work and touching the work. So kudos to you guys for asking this question. It's not an easy answer, but it is worthwhile pursuing and problem solving, and it changes lives. In education, particularly, kids get the service they need to be able to see. And we heard a particular mother of a child who is blind, and the sheer amount of advocacy this mother had to do on behalf of her child to get the kinds of services she needed, but also the kinds of implements. I'm sorry, I don't have the words for describing the kinds of glasses and additional supports that her child needed in order to make the most use of what vision she did have. Next one. Yeah, so I just want to say that's how the circles went. We tried to capture the stories in the report in part two. We tried to build a broader understanding of the journey for many Indigenous patients that come in your system. But in the end, we also wanted to lift their voices in a way that made sense to people like yourself who are board members. Where does this fit for you? Developing a strategic plan, short-term, midterm, long-term. What are those kind of key pockets of work that some, if not all of you, could get excited about? I mean, you're obviously in these positions because you care about the future of your registrants and want them to provide the best service possible. And so that standard of practice and tightening it up or changing it or modifying it or make better or turning into maybe look fors to support that particular standard of practice, I'm all for it. I think you could go away, and I think we pulled out in the report. Sorry, Sean, we did pull out different in the breakouts potential look fors. The clients all said that, they gave us specific examples of what they look for. And then they walk into an optician's office. These can easily be turned into exemplars to address and support your standards of practice. So I'll stop talking. I could talk forever, and I'll hand it back over to Fazil, and just want to thank the team here, Sean. And I think did our other colleague join us, Sean? Did I see him?
He had to jump off briefly.
Oh, okay. Okay.
Perfect. Well, thank you, Leslie. Actually, I'll turn it to Karen, our facilitator, to check in with the board for questions.
Thank you. Thank you. Derek, let's start with you.
Thank you, Karen. And thank you, Leslie, for your presentation today. It was incredibly informative. I am an optician, 30 years experience in Ottawa. I have served not as much as I think I should have, but I've served the Indigenous and I've served the Inuit community at varying times in my career here. The impression that I've taken away from both sides of the table, if you will, is that it's the patients coming to me don't like the fact that they feel different, that it feels like a process, an effort, a whole thing that has to be done. I understand the distinct and everything else, and I'm not talking about that side of it, but I'm talking about the fact that to get the billing, to get the approvals, to get all of that type of stuff makes them feel like they are not just coming in to purchase a pair of glasses, like it might be for the rest of the community who can just come in and pick up their glasses and here's my insurance card and away we go. And I know that from the professional side of it, right or wrong, biases, and I understand systemic bias is a thing, but I also understand that there's also that process of, I've seen it with my colleagues. Oh, okay, well, that's going to be an hour. That's going to be some time on the phone, faxing, whatever. And I'm that out of date on it that I'm still using faxing and phones, and we're not all doing everything on the internet. How do you think, or do you feel that is something that we kind of as a community need to look at as to how to make that process a little bit more normal, I guess, so that it's not this effort on everybody's part to serve a community that needs community serving?
Oh, absolutely. I think the findings told us that loud and clear. If there was a way to get all the parties together, either as advocates for a more streamlined system, or even just advocates for a problem-solving space to go to continually, systemically, to address these things when they arise. I think that's what we're looking for. I say we, the larger kind of community leaders who want the best healthcare, is how do we get that third party, the federal government, in its processes to streamline them so the opticians don't have to feel that way. Don't project that, and the clients have to wonder before they walk in, oh goodness, am I gonna turn this guy's day into a bad day because I'm this client, right? So yeah, it's all about that. I think that's absolutely bang on.
Thank you. Omar, and then I think I saw Tanya's hand go up as well.
First of all, I would like to thank our presenter. The tone in which you did your presentation, I felt the sincerity in it, to be honest. And I do have I do have a vested interest in different cultures and beliefs and communities, etc. My question is, as you were talking, I was taking notes. Does systematic inequities and biasness, does that exist within your community? And if so, how does it affect healthcare, education, and opportunities in general for the indigenous community?
Yeah, I think it goes two ways. And I think we heard in the stories that the one particular story that comes to mind is she's a they will have the healthcare services like the opticians or the optometrists come into the community, and they have protocols. So when they enter the community, they'll treat and welcome their guests, and they'll have either a tobacco or a smudge, or in this particular example, there was a protocol around gifting to a tree, and there was an immediate discomfort, and there was immediate complete I don't understand why we're doing this kind of belief about what was happening. And yet this person in her role as a community navigator, helping someone receive these resources from this individual, had the wherewithal to help them understand why this was an important thing for them to participate in, to gain trust and to build the necessary relationships that go beyond just what's your prescription, to help people feel comfortable in engaging with an individual like them again. And so I don't know if I'm answering a question, but I guess I got a sense that wherever the space is being made to feel welcoming and a place of humility where you can say, I don't understand this all, I think it moves from believing there's bias to moving to believing there's a place of learning that can happen in this place. And so to me, bias is when you're acting on something you have a belief about that you seem to hold to be true. And we've heard lots of stories about that. Can't pay for these glasses, so I'm not even going to show them all of those walls. I already know NIHB will only cover up to $200, for example. I can only show them that wall. So I'm going to discourage them from going over there. I'm going to just have them go over there. And then one particular story told us I had to look at the glasses that were in a drawer because that's all they believed I could afford. And they opened up a drawer, and of course they're old and outdated. So there's bias in terms of activities that way. But then there's also light, because there were other stories of individual who chose another optician and even took advice and started to stock indigenous wear that had indigenous motifs on the eyeglass wear, because they had that relationship to ask those questions and get to know each other's needs. So I'm sorry if I'm not, Omar, am I answering your question? Sorry.
You know what? I was hoping, you try your very best. I was hoping more into the cultural depth and the respect being shown and being given to the community whenever they come for services.
Yeah,
But
that's what it's all about. Honestly, Omar, that is what it's all about. It is about that, and that I think we heard that in the circles. And
right, yeah. Okay, thank you very much. I appreciate that.
Okay, thank you. I'll go to Tanya first because she had her hand up, and then Regina.
Hi, thanks. Sorry, I was having trouble finding how to put my virtual hand up, but I did find it. Thank you for your presentation, Leslie. I was wondering, I know within the Six Nations community, I know they have some right within their community, they have eye care providers, opticians, and optometrists. I don't think Chippewa and the Thames has services like that. So And I'm thinking of other communities that probably don't have services right within their First Nations. Do you think that that would build kind of a different allyship, even if it wasn't someone who was Indigenous, who, I mean, obviously that would be someone from within the own community. But if there were more services that were like geographically within those communities, do you think that would make people feel more comfortable?
Yeah, absolutely. I think that is one of the recommendations we make in the report. Not, I think it is one of the recommendations in the report that particularly for the far north, that more virtual opportunities be utilized to be present and them present in their communities accessing services. But also, I think there's lots of sites where individuals like yourselves could find yourself in front of more First Nation clients to make it more accessible now within communities to do these kind of satellite opportunities. We're certainly seeing them on the physician side of the work, but you're right. No, there's not, to my knowledge, here at Chippewa or at any of the circles, individuals, communities that were part of the circles, that there was an optometrist or optician in the community. And I think one of the recommendations was that if there was a way for the college to even encourage more Indigenous students entering into the studies and then coming out with their certifications, that would go a long way as well, almost like a recruitment strategy. Yeah.
That was actually like, you answered my question without me even having to ask it. So I was thinking similarly. So I appreciate that feedback, Leslie. Thank you.
And I don't think we have all kinds of career days. Every community has career days. I don't know that there's ever been opticians or optometrists there, honestly.
Leslie, if you ever want to connect, I live in St. Thomas, like just outside of London. I would happily come speak I'm an optician, so I'd happily come speak at one if it would be helpful. So we can connect after.
Yeah, they happen twice a year, pretty regularly around here. So for sure, we'd more the merrier. I know that much. I don't organize them, but I certainly would love to pass your name on.
Sure.
Beautiful. Thank you. Gregina.
Yes, I want to continue really on the comment of Tanya. And my comment would be about interprofessional collaboration in ICARE. Thank you very much. It was a great presentation, bringing up a little bit, to me, a lot of knowledge about what's happened in Northern Ontario. My practice is in Toronto. Only good experience with Indigenous people, no problem at all, but they don't have this geographical dispersed problem like native people in Northern Ontario. So I'm just wondering, this College of Opticians is pretty good with starting initiative with optometrists, as Fazal informed us, about providing this combination of care of optometrists and opticians. I'm wondering if, how does our government see this in Northern territories and in Northern Ontario, and are there concrete initiatives in strengthening this cooperation between ICARE providers?
I don't know if I can answer that honestly. Based on the participants and their experiences, I would say in terms of eye care, there's lots of movement under the health question of diabetes. So eye care comes in through the back door, if I can say that, because of the attention on diabetes. Outside of that, I'm not certain there's any specific strategy or momentum to address eyesight generally. So I don't want to, yeah, I can't say for sure if there's been any kind of specific strategy.
Well,
Besides those.
yes, thank you. Diabetes ties directly to eye and to eye care, like your example about the Bell's palsy or something like this. This ties to us, but it requires deeper understanding of this and deeper care. And opticians are limited in this situation. We provide very good service in terms of glasses, contact lenses, and all this stuff. But when pathology comes, there are other professionals in vision care which patients must attend. So I believe that some active thinking from our government about combination of this care and skillful cooperation, interdisciplinary cooperation would be very, very helpful. As a human body is not really compartmentalized eyes, ears, or something. No, if somebody has diabetes, the diabetes affects everything and affects eyes. So indigenous community has very high prevalence of diabetes, as we know. So in terms of input of opticians, it would be great if this cooperation is really taken seriously in this Northern Ontario areas.
I agree. The report makes that recommendation to maybe fold in a conversation with the surgeons, ophthalmologists, like because the client was clear they didn't see a difference between all of you. They assume, I think there is an assumption that you're all talking with one another as they make their journey through their eye care map, right? And many of the participants in their journey started with the optometrist. Some had to go to the ophthalmologist and then find themselves in front of you ultimately, and assume that their questions concerning their surgery or their questions concerning their prescription, you're going to have some sort of level of engagement with their doctors about it. And so I think that there's some kind of belief around wishing a more coordinated care, but I get it. Healthcare is being challenged generally, but yeah, that is the client experience. I think they think that you all talk to each other.
Yes, coordination is the key, and the very important factor is that these people live in farther distances than people in Toronto. Here we don't have this problem, but in northern of the province, this could be a significant problem. I understand. Thank you.
Absolutely.
Thank you. Thank you. All right, we're a little bit over time, but I know Peggy has her hand up, so let's make this the last question. Peggy, go ahead.
With respect to funding for eyeglasses and which frames, etc., are people allowed to pay more or to upgrade to personally supplement whatever they get from whatever program?
Oh yes, they have to. It doesn't cover enough.
Then maybe as part of our general communications, and maybe I'm overstepping what I should be suggesting, but letting opticians know to ask or offer, find some wording. I'm sure you guys who are in in your offices dealing with clients and patients all the time know how to phrase that wording so that people don't feel like here's the box you get. Because anybody's going to be offended by that one way or the other. If you walked in and somebody was assessing you wanted to spend $2,000 on your glasses and only directed you that way, you could be pretty ticked off. Maybe not offended in the same way, but not happy about it. So to me, it's case of kind of meeting people, not assuming. I think we've run into this a lot, not assuming where people are coming from and opening it up to have a dialogue so people feel heard and respected.
Yeah, I think there's a problem-solving component in that as well. Like, what it ultimately happens is for those that can afford it over the maximum, just stop getting eyewear. You know, either they're just fixing things themselves and their prescriptions are old, and they're fine with that because that's the only thing they can do because they can't afford the eyewear. But I feel as a, and within the community, we need to know this so that we can figure out a more resourced service or benefit for them, whether it's through NIHB or through the community or through other supports. And so, because I think that's the client that is most at risk, is the one who walks into an optician's office, finds out their glasses are going to be $600, and then, they're short, $200, and there's no way they're going to be able to come up with it. Like, how does that individual get caught and tapped, or so it's not consistently happen over and over? I don't have the answer to that, but it's happening. So, and particularly when it comes to children's eye health and what they're facing. So
all of these things are very individual dependent as to what somebody's tolerance level for arranging a ride, having glasses that work versus taping or gluing them or whatever the other options are. And I think everybody has a different response and sort of level at which point they're like, no, can't do that anymore. Anyway, I just want to say that I found that very informative talk. Thank you very much.
Thank you, Peggy. Thank you, Leslie. Thank you for spending a little more time with us than we had originally asked you to. I think we all found that really informative, and thank you for pondering all the questions that you were asked. Fazal, I don't know if you wanted to say any final words before we break for lunch.
Sure. Just that, next steps will include taking the information that has been yielded from the learning circles and taking them back to our clinical practice committee to ponder about how to start to create a standard of practice around cultural safety and humility, which would guide our registrants on how to engage members of this community and other equity deserving groups, because I think the learnings are transferable to many other communities. And so hopefully what we're hoping to do is by the end of the year, have a draft standard prepared. And then that draft standard, the next thing we'll do is circulate it not only to our registrants, but to the community that we got the information from, to make sure that we're hearing them right. And if this goes towards solving some of the challenges that they're facing. So as they say, nothing for me without me. So to be true to that, we will take it back to the community and get their input as one of the major drivers, and then ultimately tweak and hopefully pass it. So it's a bit of a project, but we're well on our way, and we'll be working with Leslie and Sean and the folks at council to continue this work.
thank you.
All right, thank you all. We're going to break now for lunch. My team, we're committed to coming back at 1 o'clock.
Yes, that's what's announced. So it's a little bit of a quicker lunch.
Okay.
So we'll just make sure cameras are off and muted.
Yep. So cameras off, muted. Don't leave the meeting, and we will restart at 1 p.m. See you soon. All right. Come on back, folks. Okay, I think we've got everybody back. So welcome. Hope you had a good break. We are going to pick up where we left off before our guest speaker with the monitoring reports. So since we already covered a couple of them, we're going to skip to section 5.2, which is the strategic outcomes policy. Fazal, if you want to take us there.
Sure. And as you mentioned, for those joining us on YouTube right now, we did cover 2 of the monitoring reports prior to the lunch, so they are going to be available in our recording. So I'll take you through the strategic outcomes policy monitoring report. This one takes a few extra minutes just because I'll touch on a few high level points out of the strategic plan report. So just to give a bit of background, the board usually receives this report twice a year in Q1 and Q3 of each calendar year. So you'll be seeing this report more frequently than most. The current copy is attached as an appendice in your package, as Appendix A. So this is a report. Report is a way for me to demonstrate the reasonable interpretation of the board's strategic plan and to demonstrate how we're progressing along it. So the plan that you're seeing in front of you in your package, you have been seeing for the last several years because it does cover 2023 to 2025. And so we're making always incremental updates to this policy. So looking at the policy attachment, looking at the appendice, you'll see that there's a goal that's been identified by the board, and then a column showing the strategies that we're using to achieve those goals. Key performance indicators are also a column there. You'll see an overall target for the entire lifespan of the strategic plan. You'll also see what the goal was set for 2024. You'll see evidence and data of how we have achieved this. There's a budget line, so those that have financial commitments to them, you'll see a figure attached to it. Some of them you'll see it says internal, so it's basically being done internally by staff, so it's included in the staffing budget. And you'll see a status, which is typically sort of a checkbox or an arrow going up or down, showing progress. And a summary column in the end with action items and achievements or challenges that we might be facing. So I'm sure that you've gone through the document, but what I was thinking of doing was just maybe pointing out some things that may have changed since you last saw it, or anything notable. So under 1.2, a reduction in risk to patients as a result of unauthorized practice. You'll see a little table in there in the column under evidence that shows the number of reports that were received and closed over 2023, 24, and 25 year to date. In 1.22, educate opticians, optical business owners, and other eye care professionals. Where appropriate, the college staff have applied a right touch approach to approaching UAP, which is unauthorized practice, starting with providing education and then sort of ratcheting things up. So as far as 2024 achievements, 21 resolutions in unauthorized practice matters were achieved. 1 referral from ICR to the executive committee to consider initiating legal proceedings. So that's sort of an end result where if we weren't able to get compliance through a right touch approach, the last resort is seeking legal routes, including injunctions. So we do have one that's going that route right now and probably another one during this year. 1.3, patient care is more inclusive and culturally safe. There is a 2025 goal of creating 2 resources. We're well on our way there. Peggy, our director of professional practice, has been working with the College of Audiologists and Speech Language Pathologists to collaborate with them in creating and delivering training and allyship for health professionals. So that's actually going to be happening in the next month, actually 2 months, March and April. There's 2 sessions. And as you had the conversation or the presentation from Leslie this morning, we're well on our way to the development of a standard on cultural safety and humility, with a target of hopefully the end of the year with to produce a draft. Skipping to 1.4, concerns about the conduct of opticians are addressed in a manner that is proportionate to the relative risk, transparent and accessible. The average days to close complaints is steadily dropping. You'll see that it started with 351 days in 2022, 258 days in 23, and now in 2024, complaints are closing on at about 167 days. So we're steadily trending downwards. 1.5, there's a sufficient number of qualified opticians to meet the needs of Ontario patients. Strategy 151, engaging in a public outreach and education, for considering a career in opticianry. To that end, the college and NACOR have engaged a new marketing consultant to create international facing information campaigns around the PLAR process. And in 2025, we've got budget put aside for public outreach initiatives, including funds to develop and promote PLAR marketing campaigns aimed both at international and domestic students or audiences. Regarding Goal 2, standards and guidelines, that the college is relational, accessible, and responsive to changes in technology and evolving patient expectations. I'll just point out under action achievements, we have been budgeting monies each year. This year, we've got budget put aside for 2025 for consultation with focus groups around the standards of practice and practice guidelines. Things like the emergence of anti-fatigue lenses and myopia control products are evidence of emerging technologies. The Clinical Practice Committee is actually grappling with creating guidance around that. And we have been engaging with focus groups and preparing for our strategic planning session with industry and schools to get more information around those things. So that work is steadily on its way. Sorry about all the paper shuffling. As far as action item 2.2.3, ensuring technology is being effectively leveraged to make the college processes more efficient and easy to navigate. We every year have some great wins with our streamlining. So 2024 saw online applications come online. That's one of the most time-consuming administrative tasks that the registration department has, processing typically over 200 applications every year for to become a new optician. So that process has come online. Another probably 150 to 200 applications come in to become an intern to write the exams. So again, that's been automated as well. Progress results have been shown with the renewal process. Things have changed because of the new inactive class and things like that. So the renewal portal has been updated for that. And initially now we've received positive feedback from applicants who have gone through this process using the new online processes. And with that information, we're going to be making some minor tweaks during this year to further improve the user experience. Let's see here. As far as 2.3.2, under registrants having access to high quality continuing education resources, 2.3.2 speaks to creating about 6 resources in total over the 3 years that we have this strategic plan in place. You'll see that we far exceeded that in the middle column. We created 2 resources in 2023. We created 6 in 2024. And we haven't even really started the year off in 2025. So although the target was 6, we've already got 8 in place over 2 years, and we've got more to come this year. And as far as supporting the registrant base, if you look in the far column on page 10, we've created quite a few resources and engagements. So resources include we've done a currency of practice webinar in 2024, an active class webinar in 2024, a renewal webinar, and the quality assurance department has created basically a new distance learning page on the college website where we're housing free on-demand education. As far as consultations, we've done a ton of consultations, and so they're all listed there, including around the emergency class, around registration fees, reinstatement and changing from inactive to active policy, currency, all the policies that support registration, currency practicum, refraction standards, fee amendments, and so on. So you'll see that we are constantly engaging the registrant base in seeking their feedback. In that column, you'll also see the event schedule for 2025. It's going to be a busy year and a busy spring. So we'll be in basically all over the province by the end of the year, because we're going to be working with the OOA again to join their roadshow. As far as goal 3, demonstrating regulatory leadership, on the first page under 311, you'll see that we've budgeted $15,000 in 2024 to invest in the college office space to prepare us for space sharing, and that was all completed, and we onboarded the College of Respiratory Therapists, who are now tenants of ours. And the space is basically ready to, if we can find another group to take on another day, to bring on another tenant. Moving to 3.3, working collaboratively with our system partners. As you'll see in 3.3.1, exploring opportunities with optometry. As you heard this morning, the project with that Leslie was helping us with around Indigenous engagement is basically a joint project with the optometrists. 3.3.2, a collaboration with other health regulatory colleges. With the evidence to that is the space sharing agreement that we've entered into with the CRTO, as well as the collaboration we're doing with the College of Audiology and Speech Language Pathologists on the DEI webinars. And as far as 3.3.3, relationships with key stakeholders and system partners, activities include industry roundtable both in 2023 as well as one planned for the spring of 2025. So work is underway right now, planning for that industry roundtable as we speak. So we are definitely collaborating with all groups and I think yielding some good results. So that's a little bit of a touch base on some of the high points in that document. And Karen, turn it over to you to facilitate any questions.
Wonderful, thank you. So I will open the floor to feedback or questions or concerns. Yes, Peggy.
Hi, Fazil, you made some reference there to something was covered by staff. So when we're looking at these budget items, 30,000, 40,000, 50,000, are they specific lines in the budget, or are they things that staff is covering and you're sort of segmenting out where the staff time is being spent on which things?
So typically when things like 30,000 or 15,000 are set out, if it's internal, it's just on the shoulders of staff taking care of it. If there's specific figures, it's typically tied to consulting fees or contributions to campaigns or things like that. So in the master budget, when you look at the financial variance, a lot of that is encompassed in lines such as strategic initiatives.
Okay, just a second. I want to look at something here, and of course it's on a different screen. It was one of the ones early on there that struck me. New website information, new reporting form to make a complaint about unauthorized practice, and a budget of 40,000. So that was external
So if there's programming and things like that, whether it be database driven or we have specific website vendors who help us with our website. So sometimes it requires a bit of collaboration on both front and back end.
And then the budget for the successful resolutions, is that like investigators and things like that? Oh, sorry, you hired somebody.
Right.
So in that case, it's a staffing.
Additional staffing.
The budget numbers on this form are the staff budget.
Can you just let me know what column you're looking at or what?
So I'm looking under 1.1.2 or 1.2A. Reduction in risk to patients as a result of unauthorized practice.
Mm-hmm.
And there's a 40,000 and a 60,000 and a 60,000.
So let's see here. So 40,000 was budgeted in 2023. So we've got 60,000 and 50,000. So Amy and Blessing, I just want to confirm, is that funds that we put aside for transacting cases?
Yeah, that is for the legal cost of ones that are proceeding to that stage, because at that point we have to retain external legal counsel. And it's sometimes as part of the process, there's also opinions that we seek from external counsel, even if they don't progress forward to a court proceeding.
Okay, so it's not staff, but it's hiring other professionals.
That's right.
Okay, good. Thank you.
Yeah.
Oh, well, I will ask. On the budget, when we look at the budget, what line would that be falling under?
So like as far as
that particular item is under the legal budget.
Sorry, Amy, I didn't hear that.
Sorry, Amy, I spoke over you, but it's under the legal budget line.
Okay, thank you very much.
Okay, thank you. Other feedback, questions from anyone? I'm not seeing any hands, so I think, Derek, it's safe to go to a motion.
All right, thank you, Fazal, and let's do the two-part motion again, guys. So I need somebody to make the motion that the board approved that the registrar's interpretation of the policy was reasonable. And I have somebody, Georgina, thank you, and Paul, thank you as my seconder. All in favor? Perfect, good. And can I have somebody make the motion that the board agrees that the registrar CEO complied with the policy, please? Stephen, with my first, Alicia, my seconder. Thank you very much. All in favor? And that passes.
Wonderful, thank you. So now, Fazal, will bring you back in to do 5.3, the Global Operational Constraint Policy Report.
Perfect. So this is a lot shorter. This monitoring report covers from January 2022 to 2025. And it's basically being done every 3 years. So the next time you'll see it is March of 2028. So again, I'll go through the policy requirements and then the interpretation and evidence. At first glance, it looks a little strange when you see under the policy requirement, imprudent or unlawful conduct. What we're saying is we don't want that. Most of policy governance is stated in the negative. So we're looking to avoid that. We're looking to avoid violations of commonly accepted business or professional ethics. So just keep that in mind when you're reading the report. So as far as the first requirement, imprudent or unlawful conduct, the college has met all its legal requirements and regulatory obligations in full and without delay, including posting of audited financial statements, our corporate filings, our regulatory reporting obligations, which includes a report to the Office of the Fairness Commissioner every year, participating in the College Performance Measurement Framework report, producing a health personnel database report, and now something new from the summer was introduced, a quarterly registration data report. So all of those are being met and submitted on time. As far as violations of commonly accepted business or professional ethics, during this reporting period, steps were taken that all organizational practices and decisions and circumstances were in line with these commonly accepted business and professional practices, which included compliance with all the policies related to asset protection, vendor relations, investment, and financial planning, as well as budgeting and financial reserves. And you've received during other board meetings reports on those specific policies. As far as the requirement for consistency with COO values, you'll see that the 2023 to 2025 strategic plan distinctly incorporated diversity, equity, inclusion goals into the 3 pillars. The board and its committees have received training around Indigenous anti-racism back in January of 2023. You've also received training around DEI in 2024, and you'll be receiving more tomorrow in 2025. As far as other steps that have been taken, all of the college briefing notes have been updated to include sections on public interest, diversity, equity, and inclusion considerations, and risk management considerations. So the public interest considerations speak to our commitment to our mandate. The DEI considerations speak to our values, and the risk management considerations speak to our fiduciary duties. Also, as you know today, our board meetings are broadcast publicly on YouTube, which speaks to our commitment to transparency. As far as the next requirement on avoiding unreasonable risk, we have implemented a couple of years back multi-factor authentication to safeguard our data. We're investing prudently in accordance with the investment policy. Budgeting is also done very carefully, especially in light of the introduction of the new inactive class of registration. We're very cognizant of the change or impact that can occur with people moving between active status and inactive status, and the drop in revenue that we receive from that. We're very particular about prudent succession planning to ensure that the organization would be protected in the event of a sudden loss of the registrar. The next section of the policy requires us to be prepared for emergency situations. To that end, the following steps were taken in this reporting period to make sure that we are prepared for emergency situations. That includes the approval of a regulatory amendment to create a new emergency class of registration, migrating our data to a cloud-based server, continued investment in technology. As we said, prudent financial planning and budgeting that has made it possible for us to have a healthy reserve fund and to be able to draw on that in an emergency, which we were prepared to do when we reduced our fees during the pandemic. We also have a operational contingency of 9 months that we are moving up to 12 on the advice of our auditor. As I mentioned, we have prudent succession planning. So we have, I think, covered like most bases as far as being ready for another emergency. As far as conflict of interest goes, I think sometimes to some board members dismay how often it is. Board members are required to complete an updated COI, conflict of interest questionnaire, prior to each board meeting, which they do. Conflict checks are done at every committee and board meeting. Annually, board and committee members fill out a fiduciary acknowledgement form, and members receive training around conflict of interest every year, including 23, 24, and 25. So with that, I will turn it back to you, Karen, for any questions.
Wonderful. All right, the floor is open. Not seeing any hands go up. So Derek, over to you.
All right, thank you again, Fazelle. So last of the 2-part motions. So I need somebody to make the motion that the board approve that the registrar's interpretation of the policy was reasonable. Regina, thank you. And Paul, thank you as my seconder. All in favor? Excellent, good. And now the motion that the board agrees that the registrar CEO complied with the policy. All right, Kevin, my firster. Carlo, you keep putting a hand up and I don't get you. So Carlo will be my seconder, and all in favor? Thank you very much. That passes. Karen, over to you.
Okay, wonderful. So now we're going to hear from Alicia Munyon on the status update of the 2024 board action plan. Alicia, over to you.
Yep. Okay, just double checking. We've got time, right? Okay, so 10, 15 minutes, we should be good.
Absolutely.
Okay, just as some background, in December 2019, the board approved the monitoring system policy overview. That's what we're going to look at today. Hopefully everybody's had a chance to look at my report. Basically, it comes down to 5 different criteria. So I'll just go through briefly on each of them. And if you guys got any questions, we'll cover it from there. As you saw earlier in our meeting today, we went through 4 of the different monitoring reports. But the first criteria was that we've got some type of evaluation of these monitoring reports and that we regularly use feedback to the registrar, the CEO, that we've fulfilled all the policy criteria as outlined in policy 4-25. So I've got listed here, I think, 8 different monitoring reports that we look at throughout the year. This report that we've got here covers March of last year, so March 2024 to February 2025. So these, although we cover them separately throughout the year, we do go through all of them at one point or another throughout the fiscal year. So criteria number 1, I felt had indicated full compliance and that there were no deficiencies or recommendations for that one. Criteria number 2 would be monitoring will be automatic as possible and that the majority of the board's time can be focused on designing the future. Once again, I felt that we have met this criteria fully. You'll see here that we do have a strategic 5-year plan covering a variety of topics through the board and felt that that was adequate for us to understand and at least place for review all of these different items and that we're not leaving anything out. So no action items there as well, no recommendations for any actions to be made. Criteria number 3 is monitoring of the registrar CEO is considered synonymous with monitoring the organizational performance. Once again, I felt we did a good job here and that we've got internal reports that are presented to the board for review. They are reasonable interpretations of the college's actions and they're accepted by the board. We do have periods, formal periods, where we can add feedback or question anything published in the reports. So I felt once again that this was adequately covered and I think we did a good job there. Criteria number 4 was ensuring that we've got a record of all board meeting minutes and the outcomes of any evaluations that were discussed. As you guys know, all minutes are published and signed off on the next meeting. So we do a thorough job of that. As well, we ensure that there is a frequency schedule for all the policies and reports to be reviewed so that at least through the year, we've reviewed them at least once. Once again, I felt that we were fully compliant there and no actions needed. The last criteria was that the board will record all minutes and the outcomes of the evaluation that is reasonable and whether the evidence was provided demonstrates policy achieved. Oh, sorry, that's number 4. I think we covered that one already. Number 5 is each year by January or February, the board will conduct a formal annual performance evaluation summary for the registrar. And as you know, we just completed that this year. Each policy that we review throughout the fiscal year, we have a number of considerations, including public interest, DEI, as well as risk to our community. And we've taken the appropriate recommendations and actions from there. So this criteria as well, I felt was fully compliant. We didn't need anything else to be done here. So overall, that was my summary for this year for the board policy review. If anybody's got any questions.
Any questions for Alicia?
Good.
She's happy with that.
Yeah.
All right, this, we can now move on. Oh, Grzina.
Well, no question, but I want to commend you.
Thank you.
And,
I've been
well,
voluntold for this, so.
first of all, college did good job.
Yeah, thank
And
you.
your summary concise, clear, and just admitting this.
Great.
Thank you so
Thanks,
much.
Krishna.
Wonderful. All right, thank you. So we're now going to move on to the review of the 2024 action plan, and that will be covered by Amy.
Thanks, Karen. So this is a status update. As you know, every year after the board completes your annual self-evaluation, we have a strategy session meeting where you identify some action plan items for the year. So this action plan, we'll just get that up on the screen, hopefully in a moment, was developed by this board last March and formally approved at your June meeting. So this is just to take a peek at that and just see how things are progressing as we will be going into a similar session tomorrow to build on this and identify our action plan items for 2025. All right, thanks, Carolyn. So if we just scroll down, you'll see the majority of items in your action plan are marked off as complete. We've got 2 items that are both in the governance reform category that were always sort of earmarked to be looked at kind of one at a time. So the major governance reform that was being explored in 2024 was around election districts, and the board did go ahead and approve some reforms to that structure in December. So there are 2 more governance reform items that the board has previously identified for the governance committee to be taking a look at. So they're both still marked as in progress. So one will be looking at the role and composition of the finance committee, and the second will be looking at whether it would be in the board's interest to sunset one of the professional board seats. So in other words, to go from 8 down to 7. So those are things that may be looked at by governance this year, capacity pending. In the complete section, we've mentioned the electoral districts already. There were some updates to your briefing notes to identify risk management considerations. There was some discussion around how to share the self-evaluation results that happened last year. And then there was the discussion around the number of in-person meetings. So all of that took place in the fall. And then on the next page, we've got, it was identified to engage in additional training in areas of the board code of conduct, DEI, and unconscious bias. So there was a training session held in September and a follow-up training session scheduled for tomorrow. Now also in progress was looking at a more formal process for getting some post-meeting feedback from appointed members. So that will still be looking at the different options available as we've been in the spring sort of engaging that group specific to our strategic plan, but kind of how to make this a more ongoing feedback loop. We launched a mentorship program based on the board's direction in fall of 2024. And we also had some additional facilitation training for our committee chairs and vice chairs last spring. So that is my summary, and I'm happy to take any questions.
Floor is open. Not seeing any questions. So thank you, Amy. Thank you all. And we will now hear from Derek on the proposed changes to the college's Life Member Program.
Okay. So I'm putting on my registration hat right now as opposed to my chair hat. So, so before you is a briefing note about the life member status that currently exists with the college. And the life member status, for those who are new to us, is basically a way for us to recognize kind of a combination of age and service to the profession for those who have retired from the profession. And in that case, they are non-practicing. It's just kind of a honorarium that we do for them. the current status with it. There's a whole formula for figuring it out, but the status that gives them, they are kept updated on kind of any of the college communications that are coming out, and they have the opportunity to vote in our elections. Now, with the new registration act that's come out, as we all know, I mean, we've changed that, and you can't sit there without a license, without being inactive, and a variety of other things. So we're kind of trying to figure out what to do with this category. We know it has to change. So the two questions before us really were, one, is this something we should keep? Because there is a public interest concern of a bit of confusion to the public as to us recognizing people who are no longer practicing, and that becoming a bit of an issue, because currently they show up on our public registrar, our public register, not registrar. And whether or not, if we are going to keep them, what that's going to look like. So the registration committee has been wrestling with this a little bit, and what you have in front of you is our kind of our best suggestion going forward. So the thought that we had after you've got a huge stakeholder feedback results came in, and that's all there. And basically what it boils down to is that the feedback is that they would like us to maintain some form of recognition for those who have given their life to the profession or an extended period of time to it. I will say that when you retire from the profession, you know, you're marked as no longer practicing, so whatever. But this is kind of above and beyond that. This is service. This is, you know, there's a criteria for it. You haven't had any marks against you, I guess. You haven't been up in front of the discipline panel 15 times, any of that type of stuff. So what we're thinking about doing is replacing life member, because that term is in itself confusing right off the top to anybody reading it, and switching it over to honorary retired status, taking them off the public registrar, so the registry, I should say, so that it actually has its own place where we can honor them properly without it being completely confusing for those looking for a new optician. And then take away the voting rights with the premise that they're not actively practicing, so therefore why possibly not voting, and we'll let the current active members only have a vote. So that's kind of what we were looking at. The feedback that we got from membership, it was a very really a lot of feedback, which is more than we normally get, which was actually interesting to see. But the gist of it was that you know, most of the things we've recommended, we've kind of followed in that. They want us to continue to recognize. They think it should be less confusing. They are okay in general with losing the voting rights. So I think that's kind of where we sit right now. So I guess what we've identified a few other things. The public interest, as I've already talked about a couple of times right now, with the lack of confusion. We're looking at the DEI considerations. No concerns were really raised on that. Yeah, so I mean, and as far as risk management, again, just a little bit clearer, not as misleading to the public. So I mean, I think those have been identified as well. So I guess what we're looking for right now is to go ahead with this change. We'll open it up to discussion first, though.
Yes. So, Stephen.
Thank you. Derek, two questions. First one is, for the people that are already lifetime members, would they automatically be enrolled into this new category? And
that is the plan.
Okay, good. And part two is, now, if a person is retired and decides to go back into the workplace on a contract basis for a year, 2 years or something, what happens to that retired status that they currently have, because they would now be an active member, would they not?
They would have to switch their status to an active member. They would have to go through whatever the criteria are for registration. So depending on how long they've allowed their license to lapse would actually play a factor into what was going to come next. And Amy's about to step in and tell me I either got that completely wrong or I did okay. Amy?
Not at all. You know, there's just so many technical aspects to this that are a bit different from the way they were before. And, you know, that's kind of the impetus for why this matter was brought to registration committee. So we're no longer in a world where most of our life members are sitting in this limbo, which is an administrative suspended status, where depending on how long they've been out of practice, it's sort of different routes to return to active practice. But with the new regulation, that doesn't really exist anymore. And this status is only going to be available to those that have resigned from the college. And following a resignation, if they want to return to practice, they're actually applying as a new member. They're eligible to do so, and there's nothing that would stop them from doing that, but it's not as straightforward as reinstating a license. So no, these will be people who have permanently retired in the sense that they've actually resigned their registration status. And they would be sort of noted in that sense. So if they were to return at a point in the future, they would no longer be retired or resigned anymore. So they would be kind of off that list for the time being.
Thanks,
Thank you,
Amy.
Amy.
Thanks, Derek.
Hey, other questions, discussion points? Peggy.
I was just wondering about the title that they're given and the clarity of what we're trying to say. And do we need an honorary, or could it just be on the register as that they're retired, non-practicing retired? And then how does that play into the elections? I was reading through the comments, somebody saying they're not actually making the decisions other than voting for somebody. And if people have a lifetime of experience, maybe they bring some perspective to who they're going to vote for, even if it's, well, I know this person's up on the new technology. I'm not, and maybe not up on the new technology, but I know they are. So I am just tossing out these things because you as opticians have a better feel and a better sense of it. But for me personally, I wouldn't have a problem if I saw that they were voting, and whatever the title is, I think it needs to be clear that they're not entitled to be practicing.
Okay, I heard two questions there. One was about the name for this group of people. And then the other one was around voting rights. Amy, your hand is up. Did you want to address one or both of those items?
Yeah, just to give clarification on the admin point there. So registrants who notify us that they're retired, they've either resigned or let their license lapse, they do have the option of displaying that on the register now. And this is regardless of whether they have applied for life member status or not. And that will continue onward if the proposal goes forward through the registration committee. So you have the option always of displaying retirement, and that would be next to not entitled to practice. So I just wanted to give that clarification on how that works administratively. I'll turn it back over to Derek for the other questions.
In addition to what Amy said as well, Peggy, as she said, I mean, the retired is already there. The honorary retired is going to have a slightly separate criteria of kind of history and background, and kind of have its own, basically a celebration of a lifespan in the profession. Could you please, as far as the voting goes, I believe the conversation around that as to whether or not they should be active or not, there was some back and forth with it, and I think the general knowledge and the general impression of it was that if they're not actively practicing at this time, then they probably shouldn't be actively voting at this time either, is basically what it came down to.
How did that shake down for people who are on temporary leave?
This isn't in relation to people who are on temporary leave.
No, but are people on temporary leaves allowed to vote or not? I can't remember.
People in the inactive class were a can vote. That was decided by the board last fall.
Can vote.
Yeah.
And I guess I'm feeling like maybe the retired members should be able to vote as well. But you're saying at committee that was decided to be not a good idea?
Combination of yes, at committee it was decided that we get away from that, just to keep everything as simplified as possible as far as the application and how to go forward and actually run our elections and whatnot. And stakeholder feedback did find in the majority of those who were polled through the feedback found that they would prefer that the voting be removed. It was a closer vote between those. It was a closer feedback between those two, but that seemed to be the way the majority kind of fell on this one.
And how do people here feel? Silence.
Yeah, like I said, I mean, I think it's one of those things where we did have such a really good turnout as far as feedback on this survey. It's actually one of the stronger ones that we've had, that I think we should feel fairly comfortable that we've got a good idea of what the registrants in this case, or what the membership in this case is actually leaning towards. So I feel fairly confident with the recommendations of the committee.
Oh, and could we just have a web page that says we honor these retired members?
And that is actually what has been recommended.
Okay,
Oh.
thank you. Other questions? Comments? Yes, Grzina.
Yes. I treated this little personally, retired, name of the class, retired optician. What about if we change this and we call this golden age? It happened overseas. There are some countries which use this term for eye care professionals, different than opticians, but they call this golden age. It sounds better than retired, don't you think so?
I think, Regina, and I hear what you're saying, and I mean, it's definitely got a lovely honorarium to it. I think it's a matter of confusion. I think it falls under our public interest concerns. We need something that North American society or Canadian society understands means not practicing. And I'm concerned that if we start doing things like our previous life member, we were talking about a few different ideas as well. And I worry that we're into the weeds with that, whereas honorary retired, you know, is fairly clear for the population. And I think that was the thinking. We are not necessarily completely locked into the term if the group hates it, but I think that's kind of the best that the committee came up with at this point.
Convincing. Thank you.
Thank you, Regina.
Although, for me, it sounds better. Gold age.
Appreciate that, Regina.
Other thoughts or questions around this proposal?
All right.
Okay, so more specifically, are there any issues with respect to public interest considerations? I think there's been a couple of points raised, but anything else? How about for DEI considerations? I'm not seeing anything. And risk management. Okay, so I think Derek, you're good to go for a motion at this point.
All right, so I need kind of a twofold motion at this point. I need first someone to make the motion to discontinue the life member program. May I have somebody make that? Regina, thank you very much. Kevin will be my seconder. All in favor? Wonderful. And now I need someone to make a motion to create a honorary retired, see, there it is, it's in my notes, the wrong one. Honorary retired optician program to recognize long service opticians who have permanently retired from the profession. Did I get that right? Honorary retired optician, yes.
Derek, I just want to clarify because the committee had put forward using legacy instead of honorary, just to draw that distinction between, you know, when someone is an honorary doctor, or they're granted an honorary doctorate, but they didn't actually study in that field.
Right.
Is that still how the committee would
This
like
was
to
the conversation I was stuck on, Amy, a little bit as to which one we had settled on, because in my notes I have both of them.
Okay.
The first one was honorary, second one is legacy. So which one were we using?
Well, legacy was what the registration committee motioned to put forward.
Okay, okay. Fair enough, then we'll go with what they put forward, so it's legacy. I apologize for my miscommunication on that, everybody. Yes, I remember, Carlo, you were the one who was advocating legacy, I believe.
Yeah, thanks, Amy, for bringing that up. I remember honorary was a sticking point for that reason. And
Yes. Yeah.
legacy was the proposed option that we would bring to the board. Thank you.
All right, so before we go to the motion on it, just with that in mind, give me a second, Peggy. I see you waving at me. I'm just gonna put it out to just a little bit more discussion, you know, because I presented with honorary, we meant legacy. Apologies again. Any commentary on legacy? Stephen?
Yeah, Derek, it's just moving over from the legacy edit. When we put their names on the page, at the top of that page, could we also say, and we thank you for your service?
Of course. Of course. Peggy, did you have a question or did you want to put a motion forward?
Oh, I just wanted to know what words in what order, trying to keep track of what's the noun, what are the adjectives, what's the hierarchy of our adjectives, because in the English language that matters.
So we're going to create a legacy retired optician is what it is.
Okay.
Okay. Can I have somebody make the motion to create a legacy retired optician program to recognize long-serving opticians who have permanently retired from the profession? Omar, thank you. Stephen, you're my seconder. All in favor? And that passes. Again, sorry for the confusion there, people.
Okay, thank you. Thank you all. We're going to bring Elliot into the room. Welcome, Elliot. Are you ready to go?
Hello. Yep.
Hey there. All right, so Elliot will present the governance policy review and updates. Over to you.
Great. So, as you may recall, the policy governance manual had a number of policies, and one of the responsibilities of the governance committee is to regularly review these policies according to the review schedule. At each board meeting, the governance committee will bring forward policies that are scheduled for content review as per this schedule. So this quarter, there are actually 2 policies that are up for review, and that's registration committee terms of reference and mandate policy, and fitness to practice terms of reference and mandate policy. So for both policies, no updates have been proposed at this time, as it appears they remain relevant to meet the board's needs. So the first policy we'll look at is the registration committee terms of reference and mandate policy. It's designed to outline the composition, authority, accountability, and responsibilities of the registration committee. And this policy was first approved in May 2012 and last reviewed in December of 22. Okay, so if everybody can just have a brief look at what's on the screen. And once everybody's had a chance to review, I'm going to hand it over to Karen.
All right, I'm going to open the floor for discussion. Any questions or comments? I'm not seeing any. So then can I just get a show of 5, what is it called? High five. High five, that we're good with no changes being made to the registration committee terms of reference.
Excellent.
Okay, wonderful. So now you can move to the next one.
Great. So next we're going to turn to the Fitness Practice Committee terms of reference and mandate policy. Now, this policy is designed to outline the composition, authority, accountability, and responsibilities of the, excuse me, of the Fitness to Practice Committee. This policy was first approved in May of 2012 and last reviewed in December of 22, just like the previous one. So I'm going to hand this one over to Karen and also to post on the screen.
Thank you. Any questions with respect to the Fitness to Practice Committee terms of reference and mandate? Okay, I'm not seeing any hands. I want to highlight to the board that the public interest, DEI, and risk management considerations are the same for both policies. Are there any considerations that anyone would like to put forward with respect to these two policies? All right, Derek, I think you're good to go for your motion.
All righty. I am looking for someone to make the motion that the board approve no changes to the registration committee terms of reference and mandate policy and the fitness to practice committee terms of reference and mandate policy as recommended by the governance committee. Tanya jumping right in there with their hand up for the first thing, and Paul, you'll be my seconder. Regina, your hand is up just to get my attention, or you had a question? Okay, all in favor? And that passes. All yours, Karen.
Okay, wonderful. There are a couple of hands raised. Are these new questions or comments? Alicia and Regina? No? Regina? No? Okay. All right, so we were scheduled to take a break at this point, but we are well ahead of time. How do we feel about just moving forward with the next item on the agenda? You good with that? All right. So we're going to move ahead to hearing from Amy with regards to the pre-election training module. Item 10.
Thank you, Karen. So this is for the board to approve what we will identify as the pre-election training module for elections taking place this year. So this is the module that candidates need to complete in order to meet the eligibility criteria to stand for election to the board. And every year we ask the board to approve this ahead of any election that's coming up so that we're looking at it on an annual basis and can let candidates know well ahead of time what they will need to do in order to run. We are, just so everyone knows, based on the schedule approved by the board, nominations for this year's election will probably be happening later this spring. So that's why we're asking at this meeting for you to take a look at this. So up until this point, the pre-election training module that we have identified for this purpose has been a chapter in our jurisprudence module for opticians on the Regulated Health Professions Act. And so it's chapter 4 of that tool, and it is a chapter with an accompanying multiple choice test, and it covers the legislative framework for opticianry and for regulated professions. So it was identified as a good way for potential candidates to understand the mandate of the college and what it means to be regulating a profession like opticianry. So the proposal is to approve this chapter again for this year. And that would mean that anyone wishing to participate or run for election would have an opportunity to complete that in their portal and demonstrate with a certificate of completion that they've been successful on the multiple choice test, and that will be used to confirm that they're eligible. Any questions about that before I turn it back over to Karen?
Feedback, questions? I'm not seeing any, Amy. So I think we are good to go for a motion, Derek.
Alrighty. So I need someone to make the motion that the board approve jurisprudence chapter 4 RHPA as the pre-election training module for 2025. Regina, I see you there. Carlo, we'll go you as the seconder. All in favor? And that is passed. Thank you.
Wonderful. All right, I want to confirm
May I
that,
ask a quick question, Karen, before we jump ahead?
yes,
Amy, with that as a pre-election module, is that something so that's a separate conversation from our portfolios, correct? So we would open it up again like we do with the other category for that?
It's separate from the portfolio, but if someone wants to count that toward their portfolio, they can do so. So you kind of get to have double credit in that sense. But it's separate from the if you're asking Derek, when we do a check that current sitting board and appointed members have completed their portfolio, it's separate from that process.
No, because there's another module that we do heading into our pre-training. Is that correct? I'm trying to think.
As well as part of your portfolio, every 3 years, all opticians need to complete chapter 1, which is on sexual abuse prevention and boundaries. So it's a different chapter.
And before election, we do it again?
No, not necessarily. Only if it's due.
Okay. I thought once we've done it once in our 3 years, it's locked out for 3 years. So we have to get in touch with quality assurance to open it back up to unlock it for us if we're going.
Yeah, but you don't need to redo chapter 1 unless you are past due. We do want to make sure that people are up to date with their professional obligations. If you have done chapter 4 in the last 3 years, you will be locked out of it. So you can contact administration and they'll reset it for you.
Perfect. And I just think in going forward, when we put out the package for people who want to run for election, to let them know to reach out to QA for that.
Yeah.
Okay. Sorry, Karen. You're on mute, Karen.
it had to happen sometime. We are just about ready to meet the registration department, but I believe we're waiting to see if Irina will also be joining us in addition to Anna and Emma. Do we know if she'll
Anna,
be here?
can we check in with you on that?
Yes, I will let her know now to join since we're an hour and a half ahead of, like, almost over an hour ahead of the schedule. I will let her know.
Okay.
Just please bear with me for a second.
All right. I'm just going to suggest we, if you need to turn your cameras off and take a quick stretch break, by all means do so. And once Irina joins us, we will begin. Why don't we actually take an official 5-minute break and give her a chance to get herself together. So we'll come back at 2:07 according to my clock. Okay, see you shortly. Hi, Irina. We are just.
Hi, how are you?
Good, good. We're just taking a short break for a couple more minutes. So take a moment to get yourself together and we'll be starting at 2:07.
Okay, perfect. Thank you.
You're
See you
welcome.
then. Bye-bye.
Yep. All right, everyone. Stretch break over. Once we've got folks back on camera, I will introduce our department. Actually, I'll ask Fazal to introduce the department.
Okay, so we'll just wait till we get all our board members back.
Yeah. And there's Anna. Okay. Just Regina. There she is.
Back, perfect. Okay, so this next item on the agenda is the department spotlight, something that we've been doing regularly over the past 2 years. It's a way for us to introduce members of the department to the board and its committee members. Sometimes you get communications from various people in the department. Sometimes you work very closely with these people if you're on their committee. So it's an opportunity to meet and greet members of the team, as well as get a bit of an overall overview of what the department does and what they're working on currently. So with that, I will turn you over to Anna, who is the Director of Registration. And we've got joining us part of her team, Emma, who's a Senior Coordinator, and Irina, who's Coordinator there. Anna, I'll leave it to you to present your team and your presentation.
Thank you, Fazal. Good afternoon, everyone. My name is Anna. I'm the Director of Registration. I have been with the College of Opticians since 2019. Before joining the ECO, I worked in different regulatory colleges, both health and non-health. With me today are my team members, Emma Brooks and Irina Radek, whose tireless work keeps the registration department up and running. With that, I will hand it over to Irina to introduce herself and share her presentation. Over to you, Irina.
Thank you, Anna. Good afternoon, everyone. So my name is Irina, and I'm the registration coordinator here at the college. I've been with the college since November 2021. I'm responsible for the day-to-day operations of the registration department, which includes processing incoming intern, optician, and reinstatement applications, contact lens, mentor applications, requests for certificates of standing, wall certificates, as well as answering any general phone and email queries from our registrants and applicants. I also assist with the minute taking for the registration committee meetings. During our busiest time of the year, the registration renewal period, I also manage the large volume of incoming calls and emails from registrants who need assistance with their renewal, whether they require more information or technical support. Working with our administrative assistant, Noreen, we were able to promptly assist many registrants by restoring their access to their portal and guiding them on how to upload their proof of insurance or photos. Together with Noreen, we also developed a streamlined process to complete the renewal decal mailout in a time-efficient manner, which allowed us to concurrently work on other time-sensitive projects. I'm also proud to say that despite the challenges posed by the Canada Post service disruption, we were able to complete the renewal mailout, totaling 3,316 letters and badges within 2 weeks of the renewal closure. Thank you for your time, and I would like to pass it on to Emma.
Thanks, Irina. Hi, everyone. So my name's Emma, and I'm the Senior Registration Coordinator at the college. I've been with the college since November 2021 and was previously an admissions coordinator at Chartered Professional Accountants of Ontario. In addition to processing applications and responding to inquiries, many of you may already know me from working with me on the registration committee. So I support the committee in setting up meetings and preparing agendas, posting materials, preparing files for review, and writing and issuing the related decision letters. I also conduct environmental scans to assist in policy development by researching and corresponding with other regulatory colleges regarding their policies and procedures. So some of the requests that go for committee review are registrations requiring additional review, reinstatements after over 3 years of suspension, internationally trained opticians undergoing prior learning assessment and recognition, also known as PLAR, requests for extensions to examination eligibility, and proposals to complete additional training after unsuccessful attempts at the examinations, or also known as upgrading. So taking a closer look, here's an overview of files that were reviewed in 2024 versus the preceding 2 years. So the PLAR applications held steady at 25 after we saw an increase in 2023. Well, we saw an increase in over 3-year reinstatement applications with 14 in 2024 versus 8 submitted in 2023. And after a big jump in upgrading and extension requests in 2023, we saw a slight decrease in both in 2024. We continued to hold ad hoc committee meetings to ensure files were processed promptly, and we had a total of 11 meetings held and 42 file decisions issued. We continue to receive a pretty high volume of requests from international applicants requesting PLAR. And here's a breakdown of the applications we received last year by the country that they were originally educated in. So you can see India accounted for the most by far. Nigeria accounted for 3, and then Afghanistan, Russia, Tanzania, and the UK accounted for 1 each. Another major project for our team last year was implementing the new registration regulation. So with opticians no longer able to remain suspended indefinitely, we launched a communication campaign with multiple notices sent to over 2,000 suspended opticians advising them of the change, including hard copy notices sent to over 700 registrants with no email on file. To date, out of the suspended opticians who were contacted, 56 of them have transferred to the inactive class, 74 have resigned, and 45 have reinstated their registration. The new regulation also included the launch of the inactive class of registration, and that required an additional communication campaign, including email blasts, webinars, and updates to the website. We also worked with our project management team to update our back office, create online applications in Smartsheet, and establish new procedures to process requests to change class. So far, including suspended opticians applying directly for the inactive class, we have 171 inactive opticians registered for 2025. Finally, I also run reports for staff and external stakeholders. In addition to the yearly report that we provide to the Ministry of Health, we've also begun providing them with reports on a quarterly basis. And I'm happy to report that with each of the reports we've handed in, all of the applications that we process met or exceeded the timelines that are imposed by the government. Thank you. And with that, I would like to pass it back to Anna.
Thank you, Emma. The registration team supports the registration committee in conducting regular policy reviews to ensure they align with emerging regulatory trends and the latest regulatory requirements. In 2024, 10 registration policies were reviewed and 5 new policies were developed. These changes reflect the college's commitment to a fair and transparent registration system that supports both new and existing opticians while protecting the public interest. For my next few slides, I would like to focus on metrics, starting with the new intern registrations. As you know, internship training is an essential part of optician re-education and workforce development. Intern registration allows individuals to gain supervised hands-on experience, which is crucial in preparing them for full licensure. Over the past year, we have seen a steady number of new interns registering with the college. By tracking these numbers, we can assess trends in workforce growth and plan for the future. I would like to also highlight that over 95% of interns pursue their registration as an optician following successful completion of the national examinations. One of the college's objectives is to ensure that new registered opticians are entering the profession at a sustainable rate. Every year, we monitor the number of newly registered opticians, as this helps us understand workforce trends and potential challenges. A healthy number of new registrants means that patients will continue to have access to qualified eye care professionals. We also work closely with educational institutions to ensure that pathways to registration are clear and accessible. Next, I would like to talk about labor mobility, as it is an important issue in opticianry, since professionals often move between provinces for work and personal reasons. This graph demonstrates a noted decrease in the number of opticians leaving Ontario for another province over the course of the past 3 years. Our team has been monitoring mobility trends to identify challenges opticians face when relocating. Understanding these trends will help the college facilitate smoother transitions to Ontario while ensuring regulatory standards are upheld. Moving on to registration renewal. Registration renewal trends provide valuable insights into the retention and engagement of opticians within the profession. Every year, we track how many opticians renew their registrations and whether any challenges arise during the process. By analyzing these trends, we can identify areas that may need improvement, such as streamlining the renewal system, improving communication, or providing additional support where needed. This renewal year, several enhancements were implemented to assist registrants in understanding the changes introduced by the new registration regulation, enabling them to make informed decisions regarding their registration status and to streamline the renewal process. Among these improvements were the option to apply to change class in the renewal portal, increased messaging throughout the renewal forms and registrant communication pieces, including the CEO social media platforms, enhancements to the website content, including an expanded FAQ section, and an informational webinar to help registrants navigate the changes to the renewal process. It's worth to mention that the webinar had nearly 500 registrants in attendance. Lastly, a new feature, online mentor renewal, was added to the renewal portal to streamline the renewal process for contact lens mentors. Ensuring that opticians renew on time and remain compliant is crucial for maintaining the integrity of the profession. This year, the college attained 97.6 renewal rate as compared to 95% in 2023 and 24. 138 or 4% of registered opticians took advantage of the new inactive class. You may also note a 48% reduction in registrants renewing late compared to 2024. This is the first year that the annual renewal deadline was extended from December 31st to January 15, which may have contributed to a lesser number of late renewals. We will, as a department, we will continue to refine our renewal strategies to support registrants and ensure a smooth process. Last but not least, I would like to take a look at the 5-year view of practicing opticians. This provides us with important insights into workforce trends. This data allows us to see whether the number of practicing opticians is growing, remaining stable, or declining. The chart in front of you demonstrates a noted upward trend of practicing registered opticians over the course of the past 6 years. By tracking retention and attrition rates, we can identify potential challenges such as aging workforce or barriers to entry for new registrants. This information is critical for strategic planning, helping us ensure that we have enough licensed professionals to meet public demand. This concludes our presentation, and we will be happy to answer any questions the board may have.
All right, the floor is open to questions or comments. Tanya.
Looks like you guys had a really busy year last year with those 5 new policies. That sounds like a lot. I was just wondering, I can't remember what happens to the opticians who had their license suspended, but now they haven't been in touch with us. Do they have to start all over again if they wanted to reinstate? I can't remember how the new policy works.
Currently, they're under the transitional period, which will remain in force until July 1st. We tried our best to reach out to those opticians by different means, by email, by mail. We also printed the letters that we sent to them, and we distributed them at our outreach events during the trade shows, with the notion that if anyone knows a suspended optician, to pass on that information to them so that they don't miss the transition period and they're able to make an informed decision. For now, they're able to either reinstate or go directly into the inactive class. Whoever does not take action until before July 1st, their license will be revoked. And after July 1st, then they will be treated as a brand new applicant if they decide to come in.
Okay, thank you. It seems like you guys made a lot of efforts to reach out to them. So hopefully we'll have a few more check in before the deadline. Thanks, Anna.
Thank you.
Thank you. Stephen.
Yes, thanks. Anna, with the governments, both federally and province, lowering all the different trade barriers that are going on now and the different restrictions from province to province, have you heard anything at all from our province at all? Would a person then be able to go anywhere in Canada in the future and still just meet the same basic requirements right across Canada, or will they still require individual provincial requirements?
So there's no interprovincial license. Let's say I know that the trades, for example, they have an interprovincial license that covers them everywhere in Canada. The process, they have to transfer their registration to a province where they intend to practice. It's a simple process. It's done on the basis of their good standing with another, or current standing with another regulatory college. They don't need to do any educational upgrading, but it's an individual transfer of a license.
Thank you.
Thank you. Derek, I had seen you raise your hand briefly. Was your...
I think Fazel's going to cover it better than I was about to.
Okay. All right. Fazal?
I hope I live up to that. Just a further comment to that, Stephen. I think it's a very valid point that you raise. There are discussions about removing interprovincial barriers. healthcare being a provincial jurisdiction makes it a little bit sticky as far as moving people back and forth. There has been talk at one point with the government proposing legislation called As of Right, which would allow practitioners to enter into another province and immediately start practicing and having a certain amount of time to register with the new host province. Concerns were flagged about practitioners from different jurisdictions practicing, what the liability insurance implications would be if there were complaints from the patient. How would the patient hunt down what regulatory body to lodge that complaint with, etc. So it's definitely something that we'll probably be talking about a bit more at our strategic planning session, because with what's happening with trade agreements and things like that, there very well could be a push from the government to revisit this. So I think we will be talking about it in April.
Thanks, Fazelle.
Okay, Peggy.
Quick question, Anna. I think you said how many people took up the new inactive class, but I didn't keep
171 in total. 138 of those transferred during renewal.
Okay, so is that this year or all told now?
It's the total, like 171 is the total.
From when we introduced it a few years ago.
Yeah. Well, no, it only came in force as of July 1st.
Okay, we've been talking about it for a while.
Yeah. I mean, we preemptively developed all the strategies and policies, but it all came into effect as of July 1st.
So it's really as of the last year, and it's 200 approximately?
171.
Out of how many licensed opticians? 4,000?
Yes.
Okay, thanks, Anna.
All right, any other questions? Derek.
Not really a question. I am just going to compliment Anna and her team. You guys always do a spectacular job, and you summarized it incredibly well. And it sounds like, I think he kind of underplays the sheer amount of volume that happens in this particular office in administration. And you guys do an amazing job. And as the chair of this particular committee, thank you for making me look so good.
Thank you, Derek. Thank you very much on behalf of the team.
All right, I think we are good with that. So thank you so much to the team. We're now going to move on to the registrar's report, and that will be Fazelle.
Okay. There's not a ton to cover as far as things that may not have been already spoken about during the course of this meeting, but I'll just run through it kind of quickly. As far as government relations and regulations, we are still working with the Ministry of Health with the support of Council Public Affairs, our government relations firm, as we request an exemption for spousal treatment. That was moving along quite well. We had contact with the government in January. That said, then the election happened and everything was put on hold. So now with the completion of the election last week, I do foresee probably some movement, especially because we still have the same government in place. So there's not going to have to be a relearning of our file. So we'll keep you posted how that's moving along. As far as staffing goes, you may or may not be in contact with Miss Renee Law. She is a student that we've hired on contract to assist us with the strategic planning session. So she is doing a lot of our research, facilitating interviews and focus groups, things like that. So she will be on with us during this period, ending a little bit after the strategic planning session is over. As far as special projects, aside from the day-to-day operations, we are very much focused on the upcoming strategic planning session in April, as well as co-planning the industry roundtable event with NACOR, which will tentatively be in May. So there's a lot of events that are being organized right now. External relations wise, it's going to be a busy spring as ever. We have been on top of our regular engagements. We have had some focus group consultations that have taken place already. February 11th, we had an industry consultation focus group. On the 13th, we had a registrant group and an educators consultation focus group. Actually, I think we had 2 registrant groups that day, and Karen's been very busy facilitating those. So thank you. We've got a few trade shows that we're participating in, one at Seneca for their students, and then one with the AOE and one with the OOA. So they're coming up back to back. And then we are going to be participating all year round with the OOA's traveling trade show. NACOR meetings are going to be held virtually this time for the spring, and then in person in the fall. And May is going to be our industry roundtable. So that'll kind of take us to the end of Q2 probably. As far as collaborative events, I've actually already mentioned that in our strategic monitoring report. We continue to work with the College of Optometrists on the Indigenous Engagement Project, and we are working with the College of Audiologists and Speech Language Pathologists to co-host 2 free DEI education events targeted at our respective registrant bases. And those will be held in May and April. So with that, not very exciting, but happy to take questions.
Bring them on.
I think we've worn everybody out this
I
afternoon.
think so. I think so. All right. I think you're off the hook, Fazal.
Okay.
Okay. So Derek, we're going to turn it over to you for the approval of the reports.
All righty. So in front of us, I hope everybody had a chance to opportunity to look at the dashboard and the committee reports and read through. There was a fair bit of content there. The reports are typically reviewed and approved as a consent agenda item. Basically means we do not typically go through the reports one by one, but we do invite questions or comments that you might have. But first, I'm going to hand things back to Fazal to share some highlights with us, and then we'll go with that.
Yeah, so the fact is, I'm sure everyone has read their materials. I just thought I'd mention a couple of things. One is in the executive report, you'll see that the executive exercises its authority. The executive has special powers that where there is something time sensitive, it has the authority of the council or the board to transact business. With the retirement or the resignation of Rob Vizina from his position on the board, this left an opening as far as his position on the registration committee. And so registration, as you just heard, is very, very busy all the time. And rather than wait till this March meeting, during the executive meeting, the executive took the action to place Derek Summers, our board chair, on the registration committee. Which I think was very prudent. Derek has got a lot of experience in registration, and we've got a lot of new faces on that committee. So, Derek, I believe I've heard that you're doing a great job taking care of that.
As I said, the team makes me look good.
You and the other thing is the executive heard from our legal counsel, Amy Stein, with respect to our bylaw requirements, specifically about the resignation of Rob Vizina and whether it would require filling that seat. Because it's under a year and we're constituted, even without his presence, we're not required to fill that seat, and we'll run it in the next upcoming election as per the schedule. The other couple of small things I'll mention is you got a presentation from registration giving you lots of stats. The conduct department has also done some tweaking to their dashboards. There was more information being requested to be displayed in the dash. And so you'll see that their report has an enhanced dashboard with information. So that's about it. I'm sure everyone's read the reports. And Karen, I'll turn it back to you and Derek.
Okay. So any questions or concerns? Derek.
So a couple of things. First off, for quality assurance, I'm more of a comment than anything else. Having served on that committee before, I'm really glad to see the effective use of scripts being done there, especially where it comes to, I'm willing to bet it is record keeping is the biggie that keeps popping up. And I know that's what I read in there as well. So I mean, that is really good to see. So thank you for that. Additional comment to ICRC as well. Looking at your trend over the last 3 years, amazing work keeping those times down. I mean, I think that's something that we identified a couple of years ago, and it needs to be celebrated again and again, that you're actually being more responsive and basically just being more fair to both the public and to the registrants. So good job on that. I did have a question for discipline. I know our chair is not here, but Tanya, are you the vice chair of our discipline, I believe? Yes, you look so nervous right now.
I'll do my best.
So it did say that we had a matter that had been given to discipline. And I noticed that the previous report had a matter that had been dealt with. How many matters sit in front of discipline right now? And feel free to phone a friend because I know Raj is around here somewhere.
I can't answer that question because as we haven't met, or I haven't met with anybody on discipline this year. I think I've maybe only met through an email. So I can't answer that. But I can speak to the quality assurance. I'm pretty sure all the scripts were record keeping. I think every single one was based on record keeping, Derek.
Okay. Perhaps going forward, I would be kind of curious to know how many, actually, I think Amy.
Thanks. I'm happy to jump in on that one because we don't have regular meetings of discipline. It's I think a little tricky for the chair and vice chair to always have the answers right at hand. But actually, that information is publicly available at all times. So there's one matter that's been referred and has not been yet scheduled for hearing. It's available on our website because all referrals to discipline need to be posted to our website once a notice of hearing has been issued. So you can always find that information available. So I believe in your report, you've got the name of the matter as well. And the notice of hearing with the allegations is available on the website.
Amy, I only bring it up because and this might be my faulty memory, so please excuse me. And I know it's on the website and I could go look. However, I'm not, and you're right here. So I know in previous years, we had a backlog. Have we caught up on all of our discipline matters?
Yes. I'm not aware of a backlog per se. I think there's been times when we've had more than one hearing pending, but the reasons for hearings sort of taking time to go through the process, it can vary very much from matter to matter. The issue has not been availability of panels. It's usually because there are things happening in the background between parties to determine preliminary matters or procedural steps before a matter can get to hearing.
That's how I was reading it initially. I just wanted to be for clarity to make sure that I kind of knew where we are, but thank you for that.
Sure thing.
Hey, any other comments or questions?
Could I just chime in for one more second? I just missed one item in my notes. Out of the registration report, you'll see also that the registration committee has moved administrating the PLAR process to NACOR. We were co-administering it, which wasn't very efficient. And so to be in line more with other provinces, and the fact that we're hoping that there's going to be an uptake in PLAR applications once we put our communications machine in play at a national level. I think it's probably the best move to make use of the registration team's time the best. So just an FYI there.
Okay. Final call. Questions or concerns about these reports? I'm not seeing anyone leaping. So Derek, over to you for a motion.
Well, thank you, Karen. So I am going to ask somebody to make the motion to approve the committee reports, annual committee reports, and the communication report. We haven't been given that one yet, have we? Is that separate?
We're not presenting it separately, but I think it's in the stack of reports.
Okay. All right, sorry, my bad. And the communications report as presented. Can I ask somebody to make that motion? Regina, thank you. Carlos, seconder for me. Thank you. All in favor?
All right. Alicia, was that, are you raising your hand with a question, or was that to say you were in favor?
No, it tracks it as a question when really it was in favor.
Okay.
Thank you.
You're welcome. All right. Well, just before I turn it over to Derek to adjourn, I just want to throw out a little thank you to the staff who were ready to go about an hour plus ahead of time at the drop of a hat. So thank you for that. That helped us to keep things moving. And so Derek, over to you for a motion to adjourn.
Okay, so I need somebody to make the motion to adjourn the meeting. Stephen, you're right up there. Omar, you seconded for me. All in favor?